8 to participate in the program. So I'm going to give you a quick overview. First of all, welcome everyone again, those who joined us recently. We have people across the countries, across the continents, Europe, North America, Australia, Africa, Asia, and that's why we are global. It's really very exciting. And those today, I'm your host, and I am chair of the Global Somali Diaspora. Again, my name is Jawaahir Daahir, and my co-host is Raphael Caponey. Forgive me, Raphael, if I pronounce your name.
No worries.
And Raphael is the coordinator of DEMAC, which is co-host of this summit. So I will be welcoming him in a minute. But first, I would like to give you an introduction, those who don't know about GSD, Global Somali Diaspora, and why we are hosting this summit. First of all, the aim of the summit is actually to bring together those expertise in responding to the COVID-19 and drought issues in Somalia. At the moment, we have crises that need really our attention. And the aim is really to share experience, expertise, information, knowledge, the good practice that already happening on the ground, as well as challenges that these crises, have brought to the country. And then we look in terms of recommendations. What can we do? Because at the end of the day, we want to have a solution for the problems. We discuss about it. What do we have? Where the gaps are? And how can we address this? Who can address the best? How can we work together to achieve this? So Global Somali Diaspora is a non-profit organization that aims to advocate, promote, connect, and organize Somali diaspora community globally. GSD was established as a result of representative participating in an international Somali diaspora conference convened in Istanbul, Turkey in June 2014. We believe in connecting the Somali diaspora and unifying their voice is the answer to many mutual challenges, as well as utilizing opportunities. We believe that the collective efforts and cooperation of Somali diaspora are required to safeguard and preserve Somali culture, language, and common interest. So, as I said, in terms of our members, they are from all over the world. So today we have global members who are in UK, in Austria, in Norway, and Sweden, Australia, North America, and in Somalia as well. So welcome all again. And I hope that we will have a fruitful and productive meeting, which can actually highlight the good practice that a lot of international communities and Somali-led responses are doing to respond to this crisis, and also to produce some recommendations, a focused solution kind of oriented, so that we can follow up with our key colleagues in order to increase the response and work more efficiently and collaboratively. So without further ado, I would like to welcome Raphael Caponey, who is co-host today. So myself and Raphael will be introducing the agenda today. Raphael will be doing the opening remarks, and he will introduce himself and DEMAC as well. Welcome, Raphael. Please, the floor is yours.
Thank you very much, Jawaahir, for this introduction. So yes, I'm Raphael Caponey, the DEMAC Coordinator. Very brief introduction about DEMAC. DEMAC is a global initiative and platform for diaspora organization and coordination in emergency. DEMAC stands for Diaspora Emergency Action and Coordination, and the initiative was established in 2015 and is currently hosted by the Danish Refugee Council, also known as DRC. I would like to start by expressing my sincere gratitude to global Somali diaspora, and in particular to Jawaahir Daahir for initiating this very important summit that hopefully will allow to contribute, that hopefully will allow to raise awareness on the various crises Somalia is currently facing. I would like to also express my gratitude to all the experts and speakers who have agreed to contribute to this summit, despite the very short time frame to mobilize and organize this event. So as you know, Somalia is currently affected by several crises at the same time, and the situation is increasingly worrisome. According to the United Nations, 5.9 million Somalis are in need of humanitarian aid in 2021, and it's an increase of more than 500,000 compared to 2020. The combination of the severe droughts, the COVID-19 pandemic, and lotus infestation is in some part of the country are affecting many Somalis who see their situation deteriorating by the day. Most parts of Somalia are currently facing critical water shortages, with more than 50 districts facing moderate to severe drought conditions. Extreme water shortages alone has displaced over 116 Somalis over the past 6 months. In February, as droughts intensified, about 70% of families interviewed across 8 regions of Somalia reported not having access to safe drinking water, and more than 50% of Somali interviewed did not have enough food to eat, and 80% reported harmful coping strategies such as selling livestock or buying or selling livestock to buy food, or decreasing food portion. On top of these droughts, the second wave of COVID-19 pandemic is hitting Somalia hard. Over the past 3 months, the number of cases has significantly increased, up to 300 a day, and the number of daily cases and deaths is not going down. Somalia, already fragile healthcare system, struggles with the spike in daily new infection. Finally, national and international media are currently consumed by Somalia's recent political news and turmoil, and also by the recent security incident with Al-Shabaab attacks in several parts of the country. Therefore, we witness a lack of awareness on the multiple humanitarian crises Somalis are currently dealing with and suffering from. The objective of this summit today is to improve our knowledge and to raise awareness on the impact of the COVID-19 and the drought on Somalia and on the Somali population. We sincerely hope that this summit will allow to generate an increased effort by the international community and the diaspora community to come together and to support the critical situation. This is just a brief introduction, as we have a great lineup of speakers and experts who will go in much more details in a lot of these issues. It will be a very interesting opportunity to see various perspectives from United Nations representatives, from WHO, OCHA, as well as international NGOs, also IOM, DRC. We also have health experts, doctors, and diaspora organizations who will be providing a very broad spectrum of the issue and with very different perspectives. Now I would like to leave the floor to our first keynote speaker, Dr. Magdalena Simonis. I'll briefly introduce her. So Magdalena is the president of the AFMW since 2020 and former president of the NWS since 2013 to 2020. She's a regular media spokesperson on numerous health issues. She's been interviewed every week by mainstream and medical media. Magdalena has represented the RACGP at Senate and has worked on several national health framework reviews. She has also presented at the United Nations as part of the Australian Assembly and was recently appointed the Australian representative for the World Health Organization, WHO, at the World Assembly on COVID-19 by the Medical Women International Association, MWIA. So I welcome Magdalena.
Thank you very much for having me, and thank you for the wonderful and inspirational religious introduction too earlier. Now, would I be able to share my screen? Do I have access to that? Can you help me share my screen?
Just below your...
Lovely, yes. So as an introduction, I am a doctor, and I have been introduced to the issues of the Somalian relief need through the diaspora organisation here in Australia, in Victoria. And I think that some of the points that you touched on there, Raphael, are very key to this discussion, that the issues around Somalia and Somalia as a country requiring support and increasing awareness does need to be emphasised, because individual countries can often be overlooked when there are funds and relief funds and international organisations organising relief for sectors and sections of the globe without identifying specific needs within cultures and countries. Now, in terms of our background, so we're an organisation of medical women here in Australia, and what we do is we seek to improve the health outcomes of women and children and the rest of our community as a consequence of that. We see women doctors as advocates for health and also health equity and gender equity. So it's on this premise that action can be taken by doctors who can take themselves and their knowledge base outside of their consultation room and into advocacy chambers and support organisations and countries such as Somalia in times of need. And of course, that requires awareness and better communication. Now, during COVID, of course, many African countries had already been facing some growth and economic growth and stimulation before COVID arrived. And of course, much like all economies, they've been thwarted by the COVID-19 challenge. And it's arrested the development in Somalia significantly, making the existing inequities even worse. Now, Africa as a whole is important to Australia's global interests. However, individual states within that continent and individual countries within that continent are not frequently referred to. And Australia is interested, of course, in looking after its interests in Africa. But the issue here is also about charity, giving without expecting something back. And I think that needs to be emphasised in every conversation we have around this, and with our leaders also. Now, Australia's current support focuses on health security, stability and economic recovery to help address the challenges that are faced in countries and in Somalia. And somewhere Somalia has fallen in a bit of the background of the sub-Saharan African relief program. It does also support specifically some people-to-people links, and which hopefully they're instigated and promoted to support economic growth and also provide gender equity. So there are several awards that are being provided and through organisations, charitable organisations here in Australia, and some scholarship programs. And as with most of the world, but especially Somalia, the challenges have been unprecedented and exceptional in 2020. Now, some of the targeted examples of support from Australia are the Australian Awards in Africa, and they're aimed to help address the national interests, such as stability, security and prosperity in this region, and also to support women and girls. That is an area of particular interest and concern, because we see women as a very important part of the equation in economic development and stability in any country. And this is on a backdrop of political instability and widespread recurring climate disasters. And the protection of the civilians is of utmost importance. Now, we know that Somalia's infant and maternal mortality rates are amongst the highest in the world, and that has a lot to do with access to maternal and healthcare services. And there are so few doctors per 10,000 people. They're like not even one doctor to 10,000 people, as compared to 37 or 33 doctors to every 10,000 people in Australia. So the ratio of doctors to people to deliver the services is very limited. There are also some concerns around some issues that some people have, like attitudes to females being male doctors and training females in STEM to meet the needs of women and and to see female doctors promoted and trained in Somalia. And there's also lack of affordable transport and services to traverse the long distances. So when women and children need to see the doctor, they might have to cover many kilometres on foot. The other issues, of course, that have been made worse by COVID are the access to clean water for hand washing, and certain water stations have been allocated with soap for regional districts initially, but now this has been made exceptionally worse by drought. And access to personal protective equipment and medical supplies. And also you have the other issues that we've also faced in all the other countries, where multi-generational households during lockdown poses a significant challenge on everyone who lives within the household, and in terms of the elderly, who may well be exposed to younger members of the family who are carriers of the disease but not sick from it, posing an increased risk to them. So we need to find innovative approaches that are culture specific for Somalian populations and for the regional and remote parts of Somalia also. And we also need to look at the root causes of the crises. And of course, climate is one of them, and then there's political instability that's another. And yes, we are aware now that the humanitarian solution and the provision of funds does need to be increased, especially with the locust upsurge and the floods that have been happening in the region, but also now the droughts and the ongoing second wave of the pandemic. Now, initially, I think that Somalia has fared tremendously well initially. Their response from the health minister has been commendable to the COVID-19 challenges, and the Somalian people should really be rewarded and congratulated on their approach to social distancing and hand washing. They've taken it very seriously upon themselves, and they've really taken the messages and responded favourably in as much as their capacity allows them. So I think that this is there's a wonderful example there of how good communication can achieve the community protection and improve public health. One of the effective tools that was used by the Ministry of Health was a WhatsApp account which disseminated information, and people have been encouraged to avoid gatherings, to wear the masks. And as of 15th of February, the AstraZeneca vaccine has been rolled out to individuals over the age of 50, and that program is being rolled out quite well, which is being overseen by the health minister in Somalia. And as for travel to and from Somalia, well, yes, borders were shut. Now you can enter, provided you have a test that's negative within 96 hours, which is, these are good public health measures. They probably need to be tightened now that the world is facing second waves and new clusters of different strains of COVID. Now, funds that are being, there are some very significant positive actions that have been taken by Somalia and its partners, and I think that they need to be acknowledged. And of course, the emphasis here needs to be on supporting women in the prevention and resolution of conflict and in peace building. And Somalia needs to emphasise the importance of building capacity with women to support their own communities and leadership with regard to conflict prevention and resolution. Now, the Secretary General to the UN has outlined what the current needs in Somalia are as of 2021 in January, and this was that there were 5.9 million people in need with a target of 4 million and around a 1.09 billion amount. Now, and there are about 363 operational partners, which is a logistical issue. And I think that a lot of the transparency around how this is delivered needs to be also very, very systematically clarified, so that when advocacy for and lobbying for more funding is attempted, that there's a clear pathway as to where this is all being directed. Because the key here is that it reaches the people that need the money and the support. And so it's imperative that the relief projects are released early and that they support a robust response in the country. Now, gender rights, again, I'm going to reiterate this, are a really powerful tool for development and economic growth and stability. And international women's health partnerships are significant in this particular area. And I had the privilege and pleasure of meeting with the Health Minister of Somalia on the 22nd of March, Dr. Faziwa Abukanur, and we talked about all things women's and children's health. And one of the interesting points that we both realised was that health literacy of the population and providing basic primary care through community worker training programs should be promoted and expanded. And there is an existing program which I have looked at extensively and have found very, very, very appropriate and very suitable for that kind of level of education to promote health literacy, and have talked to Dr. Noor about promoting this and providing support through Medical Women in Australia, given that medical women in Somalia are lacking in numbers, to provide the support through Medical Women in Australia to give access to women in Somalia who are willing to be trained in these programs, and to host Zoom sessions, much as we are hosting here, on a regular basis, to like clusters of Zoom sessions delivered at different across the nation to women and community representatives who are willing to learn the basics of primary care so that they can be a better support to their own country. So it's about enabling the community to support itself. The next steps, of course, are as I've described here, and also meetings such as these, which promote collaboration, strengthen relationships, increase awareness, and bring the issues of Somalia from the back foot to the national agenda. So people like myself and others from all around the countries that you have here represented can advocate to their governments for increased support and on-ground relief. We can mobilise our own non-governmental organisations and the philanthropic charity arms of the corporate sector to support targeted programs with implementation plans. And we can support through this process industry development, of course, promote gender equity and educate women, and then who educate their families and communities. And we should continue the dialogue, and this dialogue should lead to action, measurable changes, and it should also promote leadership in the Somalian diaspora, people such as yourselves who are hosting these organisations, who can then direct the programs and provide culture-specific support to the people back home. So thank you very much for listening, and I look forward to the dialogue as we continue this evening.
Thank you very much, Dr. Magdalena Simonis, and for such comprehensive insight into the issues, especially COVID And thank you very much for sharing your expertise and knowledge on this subject. I would like to welcome our next keynote speaker, who is the Director General of Somali Federal Government, Minister of Humanitarian Affairs and Disaster Management, Dr. Ahmed Abukar Ahmed. Has been the Director General of the Ministry since November 2020. Please, can you mute yourself if you're not speaking? Can I ask the technical team to mute everyone, please, except the speaker? Thank you. Ahmed, he has experience in humanitarian coordination, leadership, disaster risk management, capacity development, and advocacy at the national and state levels in Somalia. And before he joined the humanitarian sector, Ahmed, he was an academics lecturer at the University of Somalia and has done different courses in there. Mr. Ahmed holds a BA in Social Science from the University of Somalia, Master of Science in Leadership and Governance from Jomo Kenyatta University of Agriculture and Technology, and he has Executive MBA. Welcome, Mr. Ahmed. Thank you very much for taking your time. I know how busy is the ministry at the moment with the drought crisis and other humanitarian issues. So the floor is yours. Dr. Ahmed, can you hear me?
Yes, Jawaahir, I hear you, and thank you very much, and thank you for other participants for this event. First of all, I want to thank the global Somali Diaspora, their efforts that you are paying to support the Somali people who's in the country, who's in these very tough situations. So according to the agenda, I think I supposed to talk about the drought situation of the country. And if you allow me, I would like to share the screen for some slides about the drought and how the situation is.
Please do so. Thank you.
Come on. So, do you see the slides now? Hello.
Yes, we can see it very well.
Okay, thank you very much. So, according to the background of drought, as a result of decades of climate shocks, droughts and other disasters become recurrent in Somalia. Last 2 decades, Somalia experienced one or more natural disasters each year in line with man-made disasters and conflicts. According to our country's disaster profile, every 10 years we were experiencing a drought, but due to the climate shocks, the number declined to every 5 years, then to every 2 years, and now it's every 1 year we have some drought or flooding or other threats. 2017, 2009, and now 2021, have experiencing the drought that destroyed the livelihoods of millions of Somalis and forced more than 2 million displaced. Somalia is one of the frontline climate change, and the frequency of climate-related disasters increasing rapidly since 1990. Somalia has experienced more than 30 climate-related hazards, including 12 droughts and 19 floods. So the number of climate.
Dr. Ahmed, can you speak a bit louder? I don't know your volume of the speaker. If you can increase it, because it's a bit slow. Thank you.
Hello.
Yes, we can hear you, but if you can increase the volume, would be better.
Okay, I will try my best. Okay.
Thank you.
Okay. So, what about now? Is it okay now?
Much better, much better. Thank you.
Yes, thank you very much. So, most parts of the country now are facing critical water shortages, with more than 50 districts facing moderate or severe drought conditions. And according to some studies or some data, now the country, 80% of the country have a drought. The situation in particular concerning forecasts indicates a second consecutive season of below average rainfalls during the April to June this year. The federal government of Somalia is deeply concerned about the duration of the dry conditions in Somalia, which has now escalated to a drought situation. Although the good rain is started in some parts of the country, forecasts indicate below average rainfalls. Limited rainfall amounts are expected in May and June. Our expectations of the drought conditions will cause large displacement and thus will impact livelihoods and food production. According to many reports indicate that at least 3.5 million people are to be affected by drought conditions by the end of this year, and around 380,000 people are expected to be displaced. Water shortages and repeated displacement compromises access to clean water, increase communicable diseases such as cholera and measles. Vulnerability of affected populations, including protection concerns, particularly for women, boys, and girls who often have to walk long distance to fetch water. In Puntland, access to water and food are emerging as the immediate need is to people affected by the persistent dry conditions. According to HATMA, Humanitarian and Disaster Management Agency in Puntland, reports an estimated 321,600 people across the Puntland are facing extreme severe water shortages, and number are rising as the dry conditions persist. In Galmudug, the drought risk assessment conducted in January revealed acute water shortages in many parts of Galmudug, particularly in Galkayo, Hobyo, Abutwaq, Adado, and Usumrab districts. As the worst hit areas, livestock diseases have been reported across all districts and pasture depleted. In Hirshabelle, the prolonged dry conditions of the Jilal season of January to March 2021 was drier and hotter than normal, resulting in immediate loss of water and pasture among most rural communities in the state. Authorities reports of severe water shortages in pastoral and agropastoral zones in Beledweyne, Bulaberde, El Idat, El Adde, Ferlibah, Mataban, Mahas, Adale, Jawhar, Bal'at, and Warshak districts. In Southwest, according to the local authorities, dry conditions are affecting an estimated 200,000 people in several parts of the Southwest state due to the harsh Jilal season. Also in Jubaland and mostly in Gado, more than 80% of water sources have dried upon posing grave health and risk to life and livelihoods. So what is the role of the government? What is government doing in this very tough situations? The Prime Minister, in March this year, the Prime Minister nominated Interministerial Drought Committee that was supposed to plan and coordinate how that the government, also the other stakeholders, respond effectively. Also, the government try to mobilize resources and prioritize the areas based on the needs. So the government talked with the World Bank, UN, and other donors to convince them fund the current responses of drought and other shocks. So the government appealed to international friends and Somali communities to give now and to manage the impact of drought. Drought coordination meetings held with all relevant stakeholders. The renewable solutions and recovery plans strategies were initiated by the government. So the humanitarian impact of the threatened drought conditions is concerning. They are likely to be adverse effects on water for humanitarian consumption, livestock, and irrigation, including increased costs, agriculture and livestock in terms of production and reproduction, herd size products, and market price, food security and nutrition, leading to increased numbers of people in food insecure. So thank you very much. That's my presentation, and let us see your questions or comments. Thank you.
I think Raphael is going to introduce our next speaker. Thank you so much, Dr. Ahmed.
Thank you so much, Dr. Ahmed. It was a very interesting presentation, and thanks again for your availability. We'll take the question at the end of the summit when all the speakers have finished their presentation. So our next speaker is Dr. Chris Sotiropoulos, who will highlight the role of philanthropists to respond to emergency. He's the co-founder and CEO of Global Opportunities, Commercialization, and director of APAC Health. Dr. Sotiropoulos is also actively involved in healthcare international trade and charity bodies such as Rotary. He's a frequent international speaker, speaking at forums in Europe, USA, Africa, India, and the Asia Pacific on themes affecting nationalhood, capacity building, peace building, education models for emerging nation, youth, and women empowerment. So Dr. Sotiropoulos, thank you again, and the floor is yours.
Thank you very much. Hello, everyone. Chair Jawaahir Daahir, representatives of GSD, DEMAC, IOM, UN Migration, eminent speakers, international guests, friends, viewers online, and special thanks to Mr. Ahmed Toho. So let's talk about the role of philanthropists to responding to this chronic emergency. What are philanthropists looking for? Well, traditionally, they have relationships with international bodies and the diaspora. They have relationships with the United Nations. Interestingly, they're now emerging with relationships that are commercial linked. In addition to relationships with governments, for example, in Australia, very active in coordinating, leading, and partnership as well. And in fact, our organisation, GOC and Rotary, has had a very strong relationship with the Somalian Australian communities and also the African community in Australia. So we are constantly hearing about what activities and measures are needed back in the homeland of our fellow citizens. And through international groups, we are now commencing a continuing interaction. So again, philanthropy groups are looking for delivery, consistency of delivery, supply chain. They need to understand logistics, that when they are involved in a project, activities will deliver to the defined areas. They need to know that there are legal structures in place, that there is transparency and good governance, and that this allows for repeated interaction to solve very pressing problems. So in this situation, this tragedy at the moment with both COVID and drought in Somalia, who takes the lead? And this is a question which I pose to all of us from today's summit and moving forward as well. Is it GSD? Is it DEMAC?
So you have
is it the IOM group?
I'm about to create very quickly an email.
Is it a country that takes the lead? Is it a third party, or is it a combination of these? These are very important questions because philanthropists, both global or regional or national, need to understand who the lead champion is. Transposing back on the issue of today, what actions are available today to help Somalia? In the COVID-19 sphere, vaccines are available. We can get Somalians vaccines. AstraZeneca, the Pfizer, the J&J, the Sputnik, and of course there's the Chinese one as well. But we can help distribute and make those available to Somalia through philanthropic relationships. Diagnosis, wonderful diagnostic tests, rapid as well as not so rapid, but still very important. Management, what I would call management, issues like lockdown, social distancing, how you communicate that to a population, how you manage it. These systems are in place, and we have seen, for example, in Australia, which is easy to manage because it's an island and you can stop people coming in compared to other regions. We have developed very good programs for that. Hospitalisation, medical equipment, processes, we have access to that expertise. And home management. Sounds like a funny word, but what it's really saying is that how should we conduct ourselves in our own residence in this era of significant spreading, as we've noticed in the last few weeks in many parts of the world. These actions and expertise is available today, and philanthropists would dearly love to get involved to deliver these. In the drought sphere, there are many global experts who would be available to lead their assistance. Disaster relief agencies, as well as financial institutions. So what are the next steps? Well, an organising framework needs to be established, and we're happy to help to set it up or to advise on that process. But the framework needs to have leadership, as well as people who have demonstrated performance of project management and interaction with government. Now, why are these frameworks important? Because philanthropists need to be able to put resources into an existing mechanism. Again, what's available in terms of links and resources? Vaccines, management, human management, as well as hospital equipment and expertise. Funding. A lot of people say, well, it's very difficult for us to fund these tragedies of COVID and drought. But funding is available, both for governments and for groups that come in and provide remedies to particular regions, as well as expertise and experience in the drought area. The philanthropic community is waiting to be engaged. In fact, we speak to many of them several times a week about different parts of the world. And thanks to the GSD member, Mr. Ahmed Toho, who we know very well in Australia and is very well respected, this issue has become not number 10 on the list, but number 1 and number 2. So that role of the diaspora in Australia is extremely critical. And I commend the diaspora for taking that role. So the philanthropic community is waiting. The governments, including the Australian government, is eager and available to help. They are also helping initiatives locally in their backyard, the so-called Pacific Islands and parts of Asia. And resources, including money, can be allocated. Do not be dissuaded by the fact that, oh, it's very hard to get money. It isn't. When the framework is in place and the leadership and legal transparency and expertise is in place. So we're very confident that working together or assisting the collective of organisations here led by GSD, a significant impact can be made in the short term as well as medium to long term, along several of the elements that even Dr. Magdalena Simonis alerted to, in order to even stamp out quite substantially the tragedy of the pandemic, not just in the medical side, but also in other aspects of human and economic existence. So we, Australia, GSD's diaspora in Australia, Ahmed Toho and others, including Dr. Magdalena Simonis and her far-reaching relationships into the country of Australia, our group, as well as Rotary, which has substantial international networks and is looking to make a difference as well in Africa. dearly want to help Somalians directly, but also indirectly. How are we doing it indirectly? We'd love to introduce you to our networks, to the relevant funding sources, to the relevant experts, to the people who can air freight vaccines to Somalia within a few weeks. That's all I wanted to say today, but to impose on the group of us today that these issues can be resolved relatively quickly by putting in a framework in place to which international philanthropy, as well as nations such as Australia, are able to plug in their expertise, and the financial community as well sees merit in providing their resources to help Somalia. So even though this is a tragedy, we believe there is a path forward, and commend the summit for opening a very active and important dialogue in this space. Thank you.
Thank you so much, Dr. Sotiropoulos. It was really a really interesting presentation, and with a very interesting highlight on the role of diaspora in philanthropy and how government can also support. It's really insightful. I will hand it over to Jawaahir for the next speaker. Thank you again, Dr. Sotiropoulos. Thank you.
Thank you very much, Raphael, and thank you again, Dr. Chris, for giving us your invaluable time in this late evening in Australia, and sharing us your expertise. Thank you. I would like to introduce Dr. Ubah Farah Ahmed, who is a Somali Diaspora, actually medical doctor from Italy. As GSD, we're really proud of our diaspora members going back actually to the country and contributing actually the current situation. Dr. Ubah, she graduated with honors 2000, and she has worked as a medical doctor, pediatrician, and neonatologist, and she studied at Sapienza University in Rome, Italy. She has worked in Ethiopia after graduation, and also she has worked at Italian Red Cross at the Asylum Seeker Center. Dr. Ubah, she has been very active in terms of contributing the health provision in Somalia, in different regions. She has worked in North Somalia, Somaliland, in Hargeisa. And it is really good to know that has been actually sponsored by IOM and an Italian cooperation agency. So you could see already the importance of IOM and other agencies actually working together to support Somali diaspora to go back to the country and contribute. At the moment, she's Director of Family Health, Federal Minister of Health and Human Service. And she has a wealth of experience in pediatric and neonatal disease and management. Dr. Ubah, thank you very much for taking the time. I know you're very busy, and the floor is yours. Welcome.
Assalamu alaikum. Good morning, everyone. Thank you so much, Jawaahir, and all the DEMAC, Raphael, and colleagues, and all panelists. Thank you so much. It's my pleasure to be with you, and I just want to show you about COVID-19 impact in Somalia or the current situation. As Jawaahir said, I'm here since September with IOM MEDA project. I am pediatrician neonatologist, and my work was based in Benadir Hospital. Is a mother and child health center, referral hospital, regional and nationally. Okay, let's go through our presentation with slides and just talk about the COVID-19 situation in Somalia. Next slide, please. I will present you the data of the first wave and the second wave in Somalia and Somaliland, and have overview how the COVID-19 is changing the age, the gender, and so on.
I think we may having maybe technical difficult. Technical team, are you able to sort out the slides, please? I think they are busy with that. While they're sorting out the technical hiccups, which is sometimes a disadvantage of being virtual, we really wanted to bring back the focus of international communities and Somali diaspora to humanitarian issues, because at the moment, the current situation of the country, we know there is also a political crisis, unfortunately, and we're hoping for the best to be sorted out through dialogue. But we wanted to shift to that. Here we go. We have, I think,
okay. This is yes. Thank you, Jawaahir. As you see in these slides, the confirmed case actually since till 20th of April was 30,324. The total number of the first wave and the second wave, with recovery of 5,678 deaths. Actually, the disease is much more afflicted in these months in Somaliland and Puntland, although February and March was so high the death in Banaadir. The next slide, please. Unfortunately, we don't screen everybody, or even the contacts of suspect cases or confirmed cases. All what we analyze is the health seekers, the one who have symptoms, who goes to the health centers and did the test, or the travelers. These are the main reason why we do COVID tests in Somalia, because the capacity of diagnostic capacity is not so available everywhere. Banaadir region is the one who has the highest diagnostic center in all over the country. This is why we have more cases in Banaadir than other regions. If you see the graphic that is on our desk, the first wave was March and April and late May last year. As you see, COVID was always present. There was no case at all. We can't say it. It's like a perennial disease. Then you see the second wave started. Actually, in Mogadishu was the first region where we have the first case of the second wave. It was the second week of February and all March, and it was when we have the highest number of the death in Mogadishu, because we have only one referral hospital in Mogadishu where there wasn't available enough intensive care unit, neither oxygen. Sometimes we were lack of oxygen. This is why the death was so concentrated in 2-3 weeks of end February and March. This was not only Mogadishu. The service or intensive care unit isn't available all over the country. Really, in only Mogadishu, some few we can call it, because we have CPAP or some sort of ventilation, but there's no oxygen implant all over the country. I hope now for the third wave, I hope it will never arrive, but we will be so ready to have 10 oxygen implant all over the country. And they are arriving with the fund of WHO, other UN agency, World Bank, and even domestic fund, Hormuz and Dabshil, and all other our civil society have collected to have oxygen implant of the country, or a max, or every region has to have its referral hospital with oxygen implant and intensive care unit. Here is the number you see is rising from the first week of February. We have 308 cases, and the max was arrived at the end of February 1,131, and it remains for 3-4 weeks, approximately 1,000 cases for both the month, February and March. Next. Okay, this is the distribution for all the regions. As you see, Banadis has the highest case, and as I said before, this is because we have diagnostic capacity. We have a lot of centers where we can diagnostic, and compared to Somaliland and Puntland, where they have less of us in Banadil and Jubaland and so on. They got diagnostic tests, I think, at the end of February. We sent a lot of diagnostic kit. Actually, we are using rapid antigen tests, not PCR at all, because cartilage wasn't found, wasn't available almost. But although it has a high sensitivity and high specificity for the cases. Next. Okay, who is the, please back to the previous slides. The other one before, the previous, okay. Here, as you see, no. Next, please. Okay, here, as you see, something wrong. We divided regarding the age. Yes, the age. As you see, the youngest who have less than 20 years, they were the carrier, or the one who got positive test. The 33% has less than 20 years. This means they are travelers, and they are the one who got symptoms. Although the hospitalized patient was the one who has 40, 50, and 60 and above. And the fatal cases was the one who has comorbidity as the worldwide and elderly. Here, elderly in Somalia is above 60 or above 55. Because the average age is 57 or 58, as we see the national statistics, recent statistics. And so on. This is why we have to focus on, we have done a lot of campaign informing how to protect themselves. As a country, we don't have much, or as we know, COVID has no drugs, has no treatment appropriate. The way we have is only to prevent it. And we advertise it, and we encourage the people to respect mask wearing, hand washing, social distance, and so on, although it was so difficult. Compared to the first wave, second wave, there was so acceptance among our population to wear a mask. When I came here September, October, and I used to wear a mask in Mogadishu. They called me Lady COVID. Why you are wearing, or you want to spread the disease? But after they saw a lot of death and fatal cases, the people start to wear it, and they are, and also now, although it seems as the cases was decreasing, the people come to remove all preventable things. And 15 March, we got COVAX vaccine, AstraZeneca, in the country, and we started the day after to implement and to vaccine all our frontline workers, health staffs, police, municipality, elderly, and those who with comorbidity. although it's so difficult, the acceptance of vaccine and the rumors we know was circulating and misinformation regarding the vaccine, and latest was the clothing problem that AstraZeneca was accused or was raised and has been stopped in European country for some days, have just stopped it. And also recently it arrived Sinopharm for Chinese government had donated us 200,000 doses of Sinopharm, and soon we will start to distribute it. Thank you so much. Over to you, Jawaahir.
Thank you very much, Dr. Ubah. It really, opened my eyes. I hope, all, audience has found very informative and interesting. For me, it was really interesting in terms of the recovery. I thought recovery actually was quite a positive one, but also the challenges and the issues that actually on the ground in very structured and very, kind of thematic way as well across the country, and the statistics really have shown a real challenge, as well as the efforts of on the ground supporting people who are actually faced by COVID crisis, and it's really good that the people now actually got the awareness in terms of complying with the guidelines of government and health professionals. Raphael is going to introduce our next speaker. Over to you, Raphael.
Thank you, Jawaahir. Yeah, so our next speaker is Dr. Sajib. He works for WHO, the World Health Organization. As you may know, WHO have offices in Somalia, and they are coordinating the humanitarian response on the health cluster on the health side. So it will be very interesting to see WHO's perspective on the pandemic and the response as well, because they have really an overview of what is being done by the international community. So Dr. Sajib, the floor is yours if you would like to present.
Good afternoon, everyone. Ramadan Kareem. Raphael, could you please confirm whether you can see my screen?
Yes, I can see your screen.
Excellent.
Thank you.
So I'm also here joined by my colleague, Dr. Marina. She is our health policy advisor for WHO Somalia.
Good afternoon.
So this specific presentation is more like a advanced analysis of the data that is our key technical expertise as WHO. And portion of the presentation has already been presented by Dr. Ubah. Thank you very much for the brilliant presentation and the current situation, what is going on in Somalia. So as you can see that we did see the second wave of the COVID-19 in Somalia, and it started in the second half of February 2021 and is still ongoing. We did notice a gradual decline of the curve in last 2 weeks, but it is like yet to be over. One of the most important thing that I will highlight here, as you can see that the testing capacity within the country in comparison to what was available at the beginning of the emergency or the pandemic, there was no PCR testing capacity in Somalia, March 2020. And right now, in April 2021, we have 4 established PCR laboratory managed by the Ministry of Health and technically supported by the WHO Somalia. Additionally, we do also have other PCR testing capacity, which is privately owned and mostly used for the traveler screening and testing. Plus, to expand the testing capacity in country, the gene expert machines were also being used, but Dr. Ubah has already mentioned that there is a global shortage of the cartridge for the gene expert machine. So WHO is currently supporting the technical team of Ministry of Health how to expand this testing capacity within the country, because this is one of the key that as WHO, we have been highlighting from the very beginning of the pandemic that you have to test, you have to treat, and then you can take a good hold of this pandemic. So as you can see that during that month of February and March, for each positive cases, we were testing like 17 or 7 or 6. So it is like not always the same numbers, but the number is being fluctuating. But if you compare it with the beginning of this year, like let's say the first week of January, for one positive case, we used to test like 120 to 300 plus suspects, which is now 8 suspects. So out of 8 suspected cases, 1 is a positive. So that shows that like the magnitude of the infection currently circulating within the country. So this is some like advanced projection that we use as WHO to predict that which way the pandemic or the outbreak is going on in Somalia. As you can see, as of 23rd of April, our critical assumption, there is a likely decreasing trend of the outbreak in Somalia. And it is based on the assumption of the R0 and the growth rate and the doubling time. So these are like very technical terminologies that as WHO we use to see the progression or regression of any epidemic. And it's something similar, like if you see the R0 from the beginning of this outbreak up to now. So currently the R0 is varying from 1 to 1.6, which is a very good sign for us, of course, but at certain point it went high up, and that is in February 2021. The current CFR or the fatality rate is 5.1%. And many of it, I must say, is contributing to the lack of preparedness and the capacity of the health facilities to cope up with the increased number of cases. Like initially, if I can recollect it correctly, that beginning of February and last year in November and December, we used to have only 1 or 2 positive cases in the isolation center. One of the key main isolation center is the DEMAC Hospital in Mogadishu. And in the second week of February, we started receiving like 70, 80, 90 new cases every day. So none of the hospitals or the isolation centers were ready, number one, has the capacity to deal with this increased number of cases. And most importantly, what Dr. Uba has already mentioned, the increased demand for oxygen. Because this is something that as WHO, we have been advocating for a very long time. Not only the intensive care units, the critical component here for the life-saving is the availability of the medical oxygen. Unfortunately, there is a global shortage, and in Somalia, it is even more critical. So WHO is currently supporting in procuring those medical oxygen as an interim solution for the DEMAC Hospital in saving lives. In the meantime, we are also working with other partners in procuring the longer-term solution, which is the oxygen generation plants for Somalia, in close collaboration and with the other UN agencies, and of course, with the leadership of the Ministry of Health. And this increased fatality contributed during this February and March. Many of it is contributed due to the lack of oxygen in the main isolation center, which is, I have mentioned, in the DEMAC Hospital. So what was done during that time, I think that in the same time, the Ministry of Health also has involved one other hospital in Mogadishu to increase the bed or inpatient capacity to cope up with this additional admission, especially in Mogadishu. And at certain point, we were even receiving patients from other regions. I could remember that patients were being flown in from Bosaso in Puntland, from Gedo in Jubaland. So because everybody knew about the capacity of that specific hospital, and everybody was flown in because those patients could not be managed in the decentralized setup in the state level or the regional level. And this is something that I will also highlight at the end, that if you could see that we used to have 1 confirmed case out of 200 cases tests. which is in January. In February, it is now 8 to 10. So that means it's an ongoing circulation in the community. And this is also another advanced analysis that as WHO, we always continuously monitor. So it is by state, the trend of the outbreak. So as you can see in Banaadir, it's the only region in Somalia, we are predicting that the outbreak is having a decreasing trend, but it is increasing in rest of the state. So as a cumulative in the country, that the number is going up, that's for sure. This is an operational district for WHO Somalia. It doesn't necessarily match with the administrative district profile of federal government of Somalia. And the reason of this operational districts is our presence for a longer term operational capacity and rollout of our different WHO and Ministry of Health activities. As you know that WHO Somalia has been successfully working with the Ministry of Health in eradicating polio for quite some time. And this operational districts was developed during that time to ensure that every single child is being vaccinated for polio. So we use the same operational districts to stress where are those cases of the COVID-19. So as you can see, out of 118 operational districts, 74 of them has already reported at least one case of COVID-19. And I will also remind you that at least 24 of those districts, unfortunately, we don't have any access due to non-state actors present in those areas. And if you can see that the top 5 affected districts right now is Hargeisa in Somaliland, Medina in Banaadir district, Banaadir region, Garowe in Puntland, Hodan again in Banaadir, and Bosaso in Puntland. So these are the top 5 affected districts in Somalia. I have already touched partially the accessible district and inaccessible district. So what we did as WHO, because there are certain criteria we have to follow, because you cannot leave certain districts behind if they are not part of your operational coverage or something. So we did manage to conduct a rapid sampling among 44 districts that has been silent. Silent means that they didn't report any case or any suspected case. So to ensure the efficiency of the surveillance system, we did collect some random samples from those 44 districts, and out of which 5.4% tested positive. That means the virus doesn't have a operational boundary, and it really doesn't matter whether you have access or not, the virus has access in those specific areas. And those are the silent districts, mostly in Puntland. We had a positivity of 45%. That's when we ring that alarm that there is an ongoing transmission going on in the Puntland state of Somalia. And the Ministry of Health also geared up and increased their operational presence in those areas during that time. So this is the regional scenario where we are in terms of the outbreak. So as you can see, the operational curve of the Djibouti and the Ethiopia and also Kenya. So Somalia had the peak in February, which is happening right now in Ethiopia. So it's a global trend we are observing. I will skip this part. And this is a very brief update on the current status of the COVAX, because I'm very happy that many of the keynote speakers have already highlighted the importance of the vaccination, because whichever hospital capacity we have, how many beds we have in the ICUs, how many cylinders of oxygen are available, there will be never enough. So the only way to do it is prevention. And the prevention through the health education measures, prevention through masking up, hand hygiene, social distancing, and of course vaccine, which is bringing us the new hope. So part of it has already been presented by Dr. Uba. The priority groups currently receiving the vaccine are the healthcare workers, the frontline workers, including the security personnel, the point of entry staff, municipal and the teaching staff, elderly population above 50 years, and the people with the comorbidity. And this is where we are currently now, except for Somaliland. The southern states, they do have a poor uptake for the vaccine. In Somaliland, almost 62% of the frontline workers, including the healthcare providers, has already received the first dose of the vaccine. And 38% of the elderly population already received vaccine in Somaliland. So this is where we have seen the highest uptake of this vaccine. So this is it from my side, and I'm happy to take any questions from your side. But the most importantly, what we will reiterate again, that this is the new normal. No one is safe until everyone is safe. So this is what, as WHO, we have been highlighting globally, and this applies for Somalia also. Thank you very much.
Thank you very much, Dr. Sajib. It's really a very interesting presentation, and thanks also for reminding us the importance of the vaccine and the needs to make a continuous efforts to address this critical situation. Very insightful and a very good overview of the situation. Now I would like to welcome our next speaker, Philippe Bateau. He's the head of strategic planning and coordination unit at OCHA Somalia. So OCHA is the Office of the Coordination of Humanitarian Affairs of the United Nations. So it's the office that facilitates the coordination of the humanitarian response in Somalia.
Yeah, because I changed and
Did you change it?
yeah.
Can we mute people, please, while others speaking? Only this.
So yes, so I was saying that the OCHA is facilitating the coordination of the humanitarian response in Somalia, and therefore they are able to provide a very clear overview of the need and the impact of the crisis, as well as the coordinated response by international and national humanitarian actors. So we welcome Philippe Bateau. And I confirm that we can see your screen. But we can't hear you yet.
Sorry, can you hear me now?
Yes.
Great. Well, first of all, Ramadan Mubarak, and I'm honored to speak with everyone here, and many thanks for all the very interesting presentations. I think some of the topics that I'm covering today, having attended the other presentations, I think some of them have already been covered. So I will try to focus mostly on the humanitarian response and any related data also on our funding situation, because I think that's quite relevant. But maybe I can start with a short overview of where we can situate the drought and the current COVID-19 response. Overall, what we're seeing is that Somalia is facing a particularly difficult time. I think, as you're all well aware, it might be one of the most difficult years coming, based on a series of crises that we're seeing affecting the country. So, of course, there's a COVID-19 pandemic, but we've also seen quite a significant impact, humanitarian impact, by the desert locust infestation, the ongoing conflict, the current emerging political situation, and of course, these multiple shocks related to the climate and climate change. And here we're talking clearly about drought, but also about floods and flash floods and other issues related to the climate. And the result of that has been a deepening of precarity, of a very tenuous situation for many people, particularly in pastoral areas. So the current estimates that have been produced by OCHA and partners and the authorities for the coming year is that we're likely to see 5.9 million Somalis, just under half of the entire population, that require some level of humanitarian assistance and protection to survive or to sustain their livelihoods. I think it's been mentioned before by DG Ahmed a bit. We have 2.9 million people who are internally displaced. With the variable climate and the drought and of course the flooding last year, we're seeing increased urbanization. So a lot of people moving into informal sites, near urban centers, where they have minimal access to basic services. Most live in very difficult conditions, and have very limited access to livelihoods. Another core projection for the coming year, for the coming 6 months actually, is that without further assistance, 2.7 million people will face severe food insecurity and hunger over the coming 6 months. That is a projection that came out from the IPC, so that's the phase classification, which is used for food security measurements in Somalia. So that is the backdrop against which the current drought is emerging. So the situation is really quite critical, and drought is emerging at a time where there's already been a series of compounding situations, crises really, that have added to the current humanitarian needs. So to move on to the drought conditions, I think again DJ Ahmed has thankfully already covered some of these points. But yeah, essentially what we're looking at is a sequencing of bad seasons. There was the below average dairy rains last year between October and December, followed by a particularly harsh and warm Jalal season, and then currently a delayed and a poor start to the goose season. I think very importantly as well is that we're not just seeing a delayed goose season, we're also seeing projections that are showing that there will be below average rainfall in May, June, which essentially means that the projections for the drought conditions are not good. And as you can see, around 80% of the country is currently experiencing moderate to severe drought conditions. And the map on the right shows you the situation right now and the shift between March and April. And yeah, as you can see, currently the majority of the country is experiencing quite significant drought, despite the fact that in some areas rains have already started. I think that's a very important point to emphasize, is that the levels are sub-normal, which means that the drought conditions are likely to continue. The worst affected areas are in Somaliland, Puntland, the central regions, and Ghetto region. And again, as has been mentioned, we're projecting that about 3.4 million people will be affected by drought, and up to 400,000 or 380,000 people to be displaced either temporarily or permanently. That all depends, of course, on the local situation. So from our field offices, and this is information from FAO Swalem and from the FSNAU, and those are two monitoring systems for drought and for river levels, for example. I've added the sources of all of these data in a particular slide at the end, where we can look at the in-depth documents if you want to explore this further. But according to the field reports, we're seeing quite significant coping strategies being used by especially pastoralist communities. We're seeing a deterioration and depletion of pasture. I think in many areas of the country, we see 80 to 100% depletion of those pastures. With many pastoral communities currently hand feeding livestock. We have acute and widespread water shortages. I think that's been mentioned already, but essentially most surface and shallow water has dried up across the country. So we're also seeing, for example, a lot of salinated burkids, and with that, the rise of communicable diseases. That also has led to a broader use of an earlier use than normal of water trucking as a primary source of water in most pastoral areas, and of course this is quite expensive, and this adds to the socioeconomic impact of the current drought on these communities. And logically, there are poor livestock body conditions and abnormal migration to distant grazing areas. That already was mentioned in December and has continued today. We're also seeing abortion and death among small ruminants due to drought, particularly in the worst affected regions. In addition to the livestock conditions, the current lack of rain, or not maybe lack of rain, but subnormal or sub-average levels of rain, will affect the crop planting season as well. So we are expecting that will have a larger impact down the line, depending on the severity of and the duration of the drought that we're currently seeing. So to move to the current humanitarian response, 20 million has been released through OCHA from the Central Emergency Response Fund, in addition to 7 million from the Rapid Response Fund and 13 million from the SHF. These are all different funding mechanisms, but essentially they tally up to 40 million. That is going directly to the current drought response, including the support of livelihoods, food security, cash assistance, food assistance, water access, timely detection, control of disease outbreaks. However, as I've also mentioned, considering the overall needs in the country, that is by far not enough. And the current levels of funding are at a historic low. And I think that is a very important part to mention. We have drought conditions that are reminiscent of 2016, 2017. We have a host of other crises happening in the country. But our funding levels are critically low. And that is due to a variety of reasons, but one of them is definitely COVID-19 and the reduction in GDP and reduced donor spending. But currently our response plan, which stands at 1.9 billion, that's the ask, is only 13% funded. So we are expecting that number to increase based on conversations with donors, but it is still the lowest figure in the last 6 years. And it is also just historically very, very low. That means that we have increasing needs, but we have significantly reduced funding. And we're also seeing that the existing funding cuts are already impacting life-saving assistance programs. So for example, for WFP, the World Food Program, food assistance programs have been cut by 50% for those receiving, for hundreds of thousands of families currently receiving food assistance. That is a reduction already being put in place with people's rations cut by half to ensure that the current funding can last until June. So the situation is quite critical. And we are advocating for additional resources. So we have a high-level donor event next week in which we will bring together many heads of state to try to raise awareness around the issue that is being coordinated through our headquarters. But those kinds of events we will continue to organize despite the difficult funding environment at the moment to try to raise awareness around the situation. I think on COVID-19, I have actually deleted a slide because it was sheer duplication of what we've seen before from my much more informed colleagues from WHO and Dr. Uwe. So I will keep relatively short because I think the situation is clear. But it's just to highlight again the vaccination issue. Vaccination does continue across all states. Daily coordination meetings are held through the COVAX task force and others with the federal and state level to coordinate the implementation of vaccination activities. As has been mentioned, 300,000 doses of vaccines have already arrived in Mogadishu. I won't go into this again because it's been covered, but I think a key point to highlight is that there is a relatively low vaccine uptake. So even when vaccines are offered, not everyone essentially accepts to take them. And that is particularly so in Banadir region. So this has been identified as a core priority to ensure that people try to work with, well, basically that the authorities and humanitarian agencies work with the local communities to address some key sources of misinformation and try to also more proactively reach out to the communities and try to increase the vaccine uptake in these areas. I will leave it here, but these are the resources that I used, and I will put them in the link if you want to look at the full reports. And thank you for that. All the best. Over.
Thank you so much, Philippe. That was really very interesting presentation and a very clear overview of the impact of the drought in Somalia and the critical situation regarding funding and capacity of the humanitarian actors to actually fund the different crises that are growing. So thank you so much. I hand over to Jawaahir for the next speaker.
Thank you very much, Raphael, and thank you very much, Philip, for that insightful presentation on the situation on the ground about the drought issues. It's really even more, harrowing than I thought. Actually, the picture we have seen there. The next guest will be Mohammed Abdikhair, who is the Regional Director for East and Horn of Africa of IOM. Mohammed is going to be talking about current efforts by international communities. Mohammed has a wealth of experience to the East and Horn of Africa region, with over 19 years of experience on a range of immigration issues in crisis and post-crisis settings. Prior to joining the regional office, Mohammed led IOM's worldwide response to migration crisis as the Director of Operations and Emergencies at IOM's headquarters in Geneva, about 9 years. And under his leadership, IOM's programs covering humanitarian, transition and recovery, and resettlement portfolios, as well as for land, property, and repatriation, and other dimensions of transitional justice, grew both in scope and reach. We're really honored to have Mohammed with us today. I know he has a very, very busy schedule, and we value, his presence. Welcome, Mohammed, again to GSD Summit Online today, and the floor is yours.
Thank you very much, my sister Jawaahir, and thank you for inviting me. I have to apologize, my video has some problems today, so I'll be able to speak without a video. Distinguished participants and panelists, I would like first to start with a sincere appreciation to the Global Somali Diaspora organization for their leadership in organizing this summit. It is always a great pleasure and honor for me to participate in the Global Somali Diaspora International Online Summit, which during this period is again hosted virtually because of the pandemic. The Eastern Horn of Africa region is a crossroad of different migration and displacement patterns, with sending, transit, and hosting countries sharing common challenges in terms of economic development, peace and security, and health, as witnessed during the COVID pandemic. With no doubt, human mobility is a connection our countries all have in common. Again, in Eastern Horn of Africa, the consequences of climate change, including frequent drought, flooding, and more recently, the locust invasion, have exhausted the resilience of health services and local communities, forcing many to migrate either internally from rural areas to urban areas or abroad, crossing international borders. There are approximately 6.3 million internally displaced persons in the region, with Somalia alone accounting for 2.6 million IDPs. Every year, tens of thousands of Somali migrants and refugees make the hazardous journey from Somalia through the northeastern region of Somalia in Puntland and onwards across the Gulf of Aden towards Yemen and the Gulf countries. The COVID-19 pandemic had posed an additional and critical challenge for all the migrants. During COVID-19, due to the closure of borders, thousands of migrants remained stranded while en route with no assistance. This has generated an additional humanitarian emergency and burden to the pandemic response in many countries, including Somalia. Furthermore, the deteriorating socioeconomic situation due to the COVID pandemic has been also among the factors aggravating migration and remigration in the region. COVID-19 containment measures, testing, and care for millions of migrants, refugees, and IDPs in the region are complex. It implies intervening in different settings such as camps, detention centers, transit locations, urban environments, and in cross-border areas. It is also challenging due to the competing priorities of safeguarding resident populations through the closure and protection of borders and ensuring that no one is left behind with no harm. This is what has happened during COVID-19, when thousands of migrants were left behind. Preparedness and response national plans and left unattended when stranded with no assistance, except from assistance provided by humanitarian agencies. This evidence calls for action to rethink traditional public health interventions, particularly at cross-border areas, to incorporate and respond to migrants' health needs along migration routes, and fostering inclusion rather than exclusion of migrants and migration issues in public health measures and plans. Despite this solid evidence, in the current COVID-19 vaccination plans, again, migrants, and I'm talking about Somali migrants, Ethiopians, Eritreans, all of them that we see outside their own countries, are mostly excluded, particularly irregular migrants, from the vaccination drive, something we want to push for them to get the vaccinations as well. If migrants, IDPs, and refugees are left out of vaccination plans, not only is it a violation of human rights, but a serious public health concern, something we're raising with all our member states. Integration is a core principle of what we call the Africa we want, where the free movement of people shall be complemented by health assistance and care across countries, leaving no one behind. The role of the diaspora can make the difference to support this advocacy process toward the goal of the progressive inclusion of migrants, IDPs, and refugees into the universal health coverage. It can have a role bringing examples from other countries where right to health for migrants, IDPs, and refugees are embedded in public health and related statistics. We all hope that the experience during COVID-19 will not be repeated in the next epidemic. In this overall complex environment, we continue to assist migrants, IDPs, and member states during COVID-19 with a two-pronged approach as an organization. One, providing direct contribution to the national preparedness and response plan of our member states through many interventions, including deployment of medical staff in the region, performing COVID-19 tests, conducting specialized training, procuring necessary PPEs, including ventilators and telemedicine equipment, strengthening point of entry interventions and surveillance, in addition to direct COVID case management and quarantine sites management. And I can say all these are happening in Somalia with IOM teams on the ground, working very closely with the Minister of Health and other partners and the Interior Ministry of Somalia itself. Second, providing direct assistance to migrants, including those stranded, by providing food, accommodation, hygiene kits, with soap and sanitizers, COVID-19 health and hygiene sessions, counseling, COVID information, testing for the migrants themselves, and assisting them with those who are trying to return back home. We still have a large number of Ethiopians and other nationals who still come to Somalia, either to stay in Somalia or cross the Red Sea, trying to go to Yemen. Those are areas that we have to work with the government of Somalia in assisting these neighbors as well. In addition, during COVID-19 pandemic, we have continued to support UN agencies and embassies with testing and medical care to allow humanitarian actors and diplomatic corps to continue performing their duties safely. We've put over 20,000 medical testing kits for COVID-19, for example, in Somalia, working with the UN mission in Somalia that's helping in testing the UN staff and African Union forces as well, including also the Maternal Hospital itself. Ladies and gentlemen, allow me to dive into the Somali context in much more detail. For the purpose of this summit, I will address the health programming only. The IOM mission currently manages a staff of over 500, of which about 90% are Somalis, including diaspora experts for skills transfer and transfer of know-how. Health sector is one of the strong pillars of IOM Somalia. IOM's Migration Health Division is active across many regions of Somalia, directly implementing humanitarian and development and health and nutrition projects in close partnership with the Ministry of Health of Somalia. IOM is currently supporting 19 static and mobile health facilities, providing integrated health and nutrition services. We have 3 transit centers that helps other migrants, but also Somalis returning back to Somalia, either from Saudi Arabia, from Yemen, from Libya, which is also part of the support that we continue providing the Somali government. And we also have 2 migration reception centers that also support and work very closely with the government of Somalia. In 2020, IOM Somalia reached around 500,000 beneficiaries, saving lives with curative and preventive medical services. And with this, allow me to mention some of the current services that are very much connected to our response to COVID-19 itself. One, health and nutrition service delivery. We are currently operating 19 static and mobile health clinics offering integrated nutrition services for treatment of children with severe acute malnutrition, which is among the health priorities in Somalia with over 1.6 million people, and I'm talking about 13% of the population in Somalia, facing high levels of acute food insecurity. Two, community outreach and engagement is embedded in all primary healthcare and nutrition service delivery, with healthcare workers providing medical services and health education in catchment communities at least twice weekly. TB and HIV clinical mentorship program is being implemented as a clinical mentorship project through Global Fund to enhance quality and capacity of TB and HIV services in the country's public hospitals, with the aim of creating a self-sustaining system of clinical mentorship that can cascade down to all levels of the health system and ultimately beyond TB and HIV to other diseases that we face in the country. However, more need to be done and assuring early diagnosis and treatment among all the communities that we all try to respond to. And finally, capacity strengthening at the point of entry, including provision of PPEs to our immigration officers, our border officials, the police, training of health and immigration border officials, and development of standard operating procedures for identifying, assessing, and managing alerts or suspected COVID-19 cases or potentially exposed persons at the point of entries. And I'm talking about point of entries in all parts of Somalia, not just Mogadishu Airport, but other points of entry as well. However, surveillance capacity in Somalia is still very weak, and this type of assistance shall continue to be strengthened as we work closely with the government. Allow me to share some concrete examples of the diaspora engagement, and I'm very happy we just had one of our key diaspora doctors speak up in the last few minutes as well. Since 2008, we've been actively supporting the role of Somali diaspora as key development actors in Somalia through a program called the Migration for Development in Africa. The program facilitates the short-term return of highly skilled Somali diaspora resident in various countries across the world to support the development of their motherland. Since 2008, 535 Somali experts, diaspora experts, returned from abroad in Somalia to work in key host institutions, particularly the health sector, education, and governance. 127 local experts and 60 internship were trained in the relevant fields as well, using the diaspora expertise when they come to Somalia. When the COVID-19 global pandemic hit Somalia early in 2020, the media experience that the diaspora bring and the platform was successfully conducive to a rapid engagement of diaspora experts in the health sector to support the federal government and member states in efforts to prepare, response, and curb the spread of the pandemic. During COVID-19, 33 diaspora experts in the health sector, along with 52 locally recruited doctors and nurses, actively provided technical support to the Ministry of Health and Social Services at local and at national level through funding from the Finnish Ministry of Foreign Affairs, as an example. The profile of the 33 experts involved in the COVID-19 intervention embrace different health skills from surgeons. We had surgeons coming all the way from the diaspora, respiratory and TB specialists, radiologists, pediatricians, lab technicians, nurses, ophthalmologists, dentists, orthopedic doctors, internal medicine, maternal and child care experts, along with our gender-based violence and information data management specialists. That just shows the importance the diaspora has put in continuing to provide support to their motherland. The area of support work carried out by the diaspora also include training doctors and nurses on COVID-19. They've provided awareness raising on COVID-19 in schools, health centers, and through local media, including TV and radio. We've seen diaspora participation in local and national COVID-19 committees, either chaired by the president himself or the prime minister. And we've seen them working on COVID-19 treatment centers and isolation wards. In conclusion, Madam Chair, we have showed how diaspora and the international community effort had supported Somalia and its people. We can witness positive developments. However, we all know that much more needs to be done, and only with joint efforts and shared commitments, we can continue assisting and helping our brothers and sisters in Somalia. To continue responding to COVID and address the COVID drought economic impact, Somalia needs us more than ever. All IOM operations were challenged during COVID-19, and up to now, in order to maintain all our services, there is the need of mobilizing new and innovative funding resources. The role of the diaspora in this respect can make the difference, including to strengthening private sector engagement for a unique goal of saving lives in Somalia. I look forward to continue our close collaboration with the federal government of Somalia and its people, including the diaspora and donors, in defeating the COVID-19 pandemic and creating more for strengthening the health system, achieving the Sustainable Development Goals Agenda 2030, and the safe, regular, and responsible migration and mobility of our people in line with the Global Compact for safe, orderly, and regular migration. Thank you again, my sister, for inviting me, Jawaahir. I look forward to the discussions.
Thank you very much, Mohammed Abdikhair, for that and very informative and in-depth analysis into the current challenges as well as responses to the COVID-19 and the drought. And in terms of the movement of immigration, is transnational and movement is, in Africa as well as in the nearest kind of region is from Middle East, and how the IDPs have been the most hit this actual crisis, and hopefully these efforts of international communities on the ground as well as Somali government and diaspora efforts, we would be able to address some of these hopefully issues and come up with a positive solutions from the summit. Thank you very much again for joining us, Mohammed. And I will pass Raphael to introduce our next speaker.
Yes, thank you, Jawaahir. So on the same agenda point, looking at the efforts from the international community, our next speaker is Jim Kongishu. He's worked for an international NGO. He's the head of program development and quality insurance at the Danish Refugee Council. So the Danish Refugee Council, also known as DRC, is among the international NGO with the largest presence in Somalia, with countrywide programming implementing through various offices. They are responding and include protection, food security and livelihoods, durable solution, water sanitation and hygiene, as well as shelter and non-food item. So Jim will highlight the efforts done by Danish Refugee Council to respond to the current issue with the drought and as well as the COVID-19. The floor is to you.
Good afternoon, all of you. I hope you can see my screen.
Yes, we can see it and we can hear you very well.
Thank you very much. All eminent speakers of this summit, participants of this forum, DEMAC and Global Somali Diaspora, good afternoon from Nairobi, and Ramadan Kareem. I'm excited and I'm elated to be part of this very important summit that is highlighting the current issues in Somalia, and to represent my organization as well, to sort of also bring into light some of the issues as an implementing organization that we are facing on the ground in some of the work that we are doing, specifically looking at the drought response. I can say that some of the slides or some of the issues that I wanted to talk about have already been highlighted by Ahmed and Philip in earlier presentations, but I'll try as much as possible to maybe add on to what they have already highlighted, if there are areas maybe that on the ground I need just to talk about. First, I would like to introduce my organization, DRC. We are the Danish refugee organization, and we have been working in Somalia since 1997. So we have been around for quite some time. We work right across Somalia, and some of the organizations like IOM are our partners on the ground in Somalia. We do implement on the ground with IOM and of course other humanitarian actors. The slide in front of you is we wanted to just highlight some of the issues from a pictorial perspective, because this is what is happening in Somalia year in and year out, and especially now when there is drought. As you can see in the first slide, we have a picture of people that are trying to offload their wares, and also trying to make some construction of some shelters of some sort. And this picture was taken in Gedo region, in Kabasa camp, where people have been migrating or have been moving from the rural areas into Dolo, where it's relatively safe. We had some crisis in Dolo where we have insecurity, as well as drought, which has already been highlighted. And in the next slide, in the next photo, you can see some people also that are on move. And this picture was taken last year at the height of the flooding in Beletwen. We all know, most of us are aware that we have a perennial issue of flooding in Beletwen, and this is part of the crisis that we have been responding to. So these two slides in general, or in summary, portray the situation in Somalia, or the expected situation in Somalia in the next few months, and some of it is already happening. In the next slide, I had planned to talk about the statistics, and I am not going to dig deep into the statistics because my colleagues have already talked about the statistics, the people affected, people in need, the people that require humanitarian assistance. I will not get into the details of that, but just to say in the last bullet that the remittances from the diaspora in Somalia are a big contribution to the livelihoods in Somalia. And at the moment, we are witnessing a sharp decline in remittances. And this is partly due to the global effects of the pandemic. I think it's estimated up to 40% decline in remittances. And so this is also having a big impact on the drought situation. The people are suffering. And then, of course, part of the survival mechanisms of the people is we are witnessing negative coping mechanisms. My colleague Philip talked about the poor livestock body conditions, especially for the pastoralists, as well as malnutrition and displacement, which has increased the figure now to 2.9, the number of Somalis that are displaced to 2.9 million from 2.6 million last year. That's the next slide. I wanted to talk about the most affected regions, and I will not get into the details again because Philippe has already talked about the IPC classification. And this is a classification that shows the people that are affected, the 2.7 million, where are they in Somalia? The people in crisis, IPC 3 and emergency IPC 4. These are some of the top regions where we find the people that are affected by the drought. But in general, I have to say that the drought is biting right across Somalia, and people are affected right across the country. It is a grim situation, and the funding, of course, Philippe talked about it. We are not seeing, it is not very promising at the moment compared to other years where we have also had a similar crisis of drought in Somalia. What is DRC doing at the moment, at the present? What are we doing to respond to the drought crisis in Somalia? Despite the fact that we have the drought in Somalia at the moment, I have to say that markets are still functional in Somalia. The spirit of enterprise still lives among the Somalis. And because of this, DRC, through the funding that we have been able to generate, we have been doing a lot of multi-purpose cash transfers. And some of these initiatives that I'm talking about are just beginning. They are not initiatives that have been there. They are just beginning. And in the Gedo region, which is in Jubaland, we have multi-purpose cash transfers that we are targeting people that have been affected by drought, but also conflict. And in Puntland and Mogadishu, we also have another multi-purpose cash transfer program that we are targeting. And also in Baidoa, we also have a similar program where we are targeting people that have been affected by drought and people that have moved into the IDP areas. These are our main focus at the moment. In the Sanag, Bari, and Nuga region, that is, this is in Puntland, we have planned a food voucher program and cash transfers. We have not yet started, but I have to say that despite the fact that our target is to reach 150,000 people, this is a drop in the ocean, given that 2.7 million people are already in IPC 3 and IPC 4. So a lot still needs to be done with these cash transfers that we have started. In Banadil and Hill Shebele region, we also have a safety net program, but this does not specifically target drought response. It is a poverty alleviation program, but it helps the people that we target because the same people that have these poor households are the same ones that are facing the drought situation or the drought conditions in Somalia. We also have a WASH program targeting more or less the same areas where we have the cash program. And mainly, as highlighted by Philippe, we have water tracking as the main source of water at the moment because most of the water sources have dried up, and we are taking water to the people. In a few locations in the Gedo region, we are also constructing new water sources in areas that show promise of fresh water, underground water, as well as rehabilitation of water sources in the Seoul and the Sanag regions up in the north. And in our interventions, we also ensure that we have an integrated WASH response, whereby we also construct sanitation facilities and conduct extensive hygiene promotion in the same areas that we target with water tracking or rehabilitation and construction of water sources. In addition to that, and because of displacement, we know or we have witnessed that in Somalia, when we have drought, we have movement from the rural areas into the urban areas. And DRC, in its protection efforts, we have been prepositioning NFIs and also shelter kits, emergency shelter kits, to respond to the displacement of these people who are going to the IDP camps and they do not have shelter when they arrive. So these are some of the initiatives that we have instituted as DRC. But as I've said, our WASH response targeting 70,000 people, and our food security response targeting 150,000 people. It's a drop in the ocean. We are collaborating with other actors on the ground. DRC is not the only actor on the ground. We have other international NGOs, we have local NGOs, as well as the government, and we are coordinating with all these organizations, of course, through the efforts of OCHA, which really does a lot of coordination to ensure that we have effective programs, that we are not duplicating our efforts in the areas where we have interventions. So in the next picture, I just put a picture in one of our initiatives where we are doing water tracking, and that is a truck right over there that is delivering water to some of the households in the IDP camps, which is one of the areas that has been hard hit by the drought and the displacement thereof. What are some of the challenges as an international NGO or as an NGO that we are facing on the ground? I think the issue of funding is a critical issue at this point in time, and it needs to be highlighted in this summit because we are seeing very low levels of funding against very high needs, and this challenge is affecting the way most of the local and international NGOs work on the ground. We are only able to respond when funds are available. The next challenge that we have witnessed is the insecurity in some of the areas, not in all areas, but in some of the areas. Access is still an issue because of areas that are still controlled by insurgents. And in some of these areas, these are the areas with some of the highest needs. Negotiation with some of those non-state actors in order to access some of those areas is required so that we are able to reach the people in need or the people that are faced with the drought conditions. And then, of course, we have the complex nature of the needs. The COVID-19 was already highlighted. The locusts, as we talk about drought, we have the COVID-19, and now we have the locusts that have been decimating farmland and destroying crops for the agrarian communities that are, especially the ones that live in riverine areas. We have seen a lot of destruction of crops in some of these areas. I would like to highlight that at this point, we are talking about the drought response, and many of the organizations that have been able to secure funds are just beginning to mount a response. It is late. This should have come much earlier because it was already predicted. The La Nina was already predicted, and it is happening now. And then, of course, COVID-19 has other dynamics like restriction of movement and physical restrictions, interactions that we are not able to move around. And even for the people that they are not able to participate in socioeconomic activities because, they cannot go to those areas where they are supposed to be working. They have lost jobs. And of course, this has a very negative impact on their coping mechanisms. And then I cannot overemphasize the issue of the political issues in Somalia. It is also affecting the way donors work. It has an impact on the way the donors work. We would like to work very closely with the government. And when there are certain issues, that have not been resolved, then this also affects the way we engage with the government. And ultimately, it has an impact on the people. And then, of course, I have at the beginning mentioned that we have an issue with the shrinking remittances, and remittances have really been one of the biggest contributions to alleviating some of these crises in Somalia and ensuring that the people have some bread on the table. What are some of the opportunities that we can identify, or how can we help? As DRC, we have what we call the SOCAB, which is a crowdfunding system through which the diaspora donors, the private sector, well-wishers, and other stakeholders are able to contribute or can contribute to the drought response efforts in Somalia. And then, of course, ongoing coordination is another opportunity that we continue coordinating with the humanitarian actors, and of course, under the leadership of OCHA and the government, and other key actors such as UNICEF, WFP, and the diaspora and the private sector. And then, of course, in order to be able to respond effectively, we need to conduct analysis and assessments to ensure that we are able to prioritize our response to reach the most needy, the people that are most deserving of this assistance. Further advocacy is needed in order to scale up fundraising or to secure more funds to be able to respond to the drought. And then, of course, we also need to do early warning and preparedness, including stockpiling or being able to stockpile resources that can be distributed to the affected. And then we already know that so the Somali government has been relatively stable, and funding to developmental efforts has been ongoing. When there is a crisis, some of these development programs cannot continue. Therefore, this is what, in many of the programs, we have what we call a crisis modifier. In some programs, we don't have development programs, we don't have crisis modifier, but we urge development programs to be able to set aside this crisis modifier to ensure that we are able to respond to the drought, and so that we are able to go back and continue with our development programs when we have been able to resolve the crisis and the people are able to participate once again in the development efforts. My last slide is just to show you, or to show you where we work in Somalia. But as I mentioned, we work right across Somalia, from in Somaliland, in Berbera, in Mogadishu, right to the Horn of Africa, to the Horn tip, Bosaso, and to the south until, to the central regions and up to the south, up to Kismayu. We have programs right over there. And I will not repeat again what has been said in terms of our sectors. We are displacement organization, protection organization, and ensuring that displacement affected populations are served or they receive services, humanitarian services. So this is a short of my presentation, and I'm very glad that you have been patient to lend me your ears. We can do more by working together and by ensuring that some of these issues, especially the drought issues, are brought to the fore to the international community. Thank you very much for paying attention.
Thank you so much, Jimmy. It was a very interesting presentation. It's also really good to hear the challenges from international organizations that are also currently facing issue to raise funding and to respond to the need, and feeling that it's a bit of a drop in the ocean when we look at the amount of needs that are in Somalia at the moment. I hand over to Jawaahir for our next speakers.
Thank you very much, Raphael, for concluding that, and also thank you very much, Jim, again, and for such elaborated information about the drought and the impact and the challenges, as well as the Danish Refugee Council response on the ground, which is quite very useful to know and encouraging. I would like to welcome now our Turkish guests, August Yilmaz and Orhan Koçu. And forgive me if I mispronounce your names, from Turkish Red Crescent and Diyanet organizations. We know the Turkish government and Turkish humanitarian organizations, they are on the ground, and they were really at the front row in terms of responding to COVID-19 as well as the drought issues. We know, Turkish has been tremendous for Somalia and Somali community as in partnership with Somali government and also international communities. Our Turkish delegation, they will be speaking in Turkish language. We have Yasin Bashir, who is the close colleague of the Turkish ambassador in Somalia, who will be facilitating in terms of the translation of the speakers. So it's going to be a bit, I think, longer. I will ask our Turkish delegates if they can summarize their thoughts and give Yasin to interpret to the audience. Thank you very much. Welcome.
Thank you. Firstly, hi everyone. Ramadan Kareem from Mogadishu, from Somalia. I speak, as you say, I speak Turkish language, and Mr. Yasin, he translate for us. İnşallah. Öncelikle bu katılımı sağladığınız için ben Diaspora organizasyonuna çok teşekkür ediyorum. İsmim Oğuz Yılmaz. Ben Diyanet İşleri Başkanı, Turkish Diyanet Foundation adına Somali'de 3 yıldır aşağı yukarı görev yapıyorum. Kısaca ben Diyanet İşleri Başkanlığı ve Türkiye Diyanet Vakfımızın buradaki faaliyetlerinden bahsetmek istiyorum. Giriş olarak istersen Yasin sen bir şey yap, giriş yap.
First of all,
ses gelmiyor.
Yasin, if you can increase the volume of your speaker. Yes, thank you.
I think you can hear me now.
Yes, very much. Yeah, thanks, Yasin.
Mr. Oğuz is representing the Turkish Diyanet Foundation. Diyanet Foundation is an organization working in Somalia, and have been working in Somalia for the last 10 years. And Mr. Oğuz thanked the global Somali diaspora for organizing such important meeting. So he will be summarizing the activities of the Diyanet Foundation, and I will summarize it in English. So.
Okay. Diyanet Vakfı olarak 2011 yılından bu tarafa 10 yıldır buradayız. Ve bizim çalıştığımız alanlar eğitim faaliyetleri. Eğitim faaliyetleri içerisinde Mogadishu ve Somaliland bölgesinde 2 tane okulumuz mevcut. Onun haricinde Mogadishu Üniversitesi ve farklı üniversitelerde burs vererek desteklediğimiz Somali kardeşlerimiz var. Ayrıca buradan Türkiye'ye gitmek isteyen, Türkiye'de okumak isteyen üniversitelerde ve lisede okumak isteyen kardeşlerimize de yardımcı oluyoruz. Onun haricinde Somaliland'de de eğitim merkezi aracılığıyla o bölgenin halklarını bilinçlendirme, bilgi verme ve eğitme konularında yardımcı olmaya çalışıyoruz. İkinci çalıştığımız alan ise sosyal yardımlar ve insani yardım. Bizim şu anki konumuzu ilgilendiren alanda bu. Ramazan yardımları, kurban yardımları, afet veya acil kuraklık, sel durumlarında yaptığımız yardımlar. Onun haricinde yetim, Somali'deki yetim kardeşlerimize sahip çıkma, katarak ameliyatları, tekerlekli sandalye dağıtımı gibi buradaki çeşitli sebeplerle engelli duruma gelmiş kardeşlerimize bu tür yardımlar. Onun haricinde şu anda kuraklıkla alakalı olarak bizim en çok faaliyet gösterdiğimiz alanlardan bir tanesi kuyu faaliyetlerimiz. Şu ana kadar Somali'nin aşağı yukarı bütün bölgelerinde artezyen dediğimiz büyük depolara sahip ve insanların ve o bölgedeki hayvanların faydalanabileceği kuyular açmamız yaklaşık 8 bölgede şu ana kadar açtık. 2 bölgede de şu an çalışmamız sürüyor. İnşallah yakın zamanda çalışmalara başlayacağız. Bu kuyularımız şöyle bahsedeyim. Mesela en son açtığımız kuyumuz Sol bölgesinde, Puntland Somaliland arasındaki Sol bölgesinde oradaki 20 köye hitap eden ve yaklaşık 100 bin insan ve hayvanın faydalanabileceği bir kuyu. Kuraklık zamanlarında veya yağmur olmadığı zaman o insanlar ve hayvanlar oradan çok rahat bir şekilde faydalanacaklar. Onun haricinde kuyu olarak sati kuyularımız var. Onlarca açıyoruz ama biz daha çok artezyen, böyle 20-30 yıl, 40 yıl sürebilecek, insanların ihtiyacını karşılayabilecek kuyular için çalışma yapıyoruz ve bu çalışmalarımız da devam ediyor. Onun haricinde kuraklıkla alakalı olarak bundan Ramazan'dan 2 hafta öncesinde Gedo ve Southwest bölgesinde çalışma yaptık. Ve oradaki kuraklıktan etkilenen ve çeşitli sıkıntılar çeken kardeşlerimize belli miktarlarda gıda yardımında bulunduk. Bu manada buradaki Kızılay'daki arkadaşımız COVID-19 ile alakalı sizlere bilgi verecek ama genel olarak Türkiye Cumhuriyeti ve Türkiye Büyükelçiliği ve onun altındaki bizler, Türkiye Diyanet Vakfı ve diğer kurumlarımız Somali'deki kardeşlerimize 10 yıldır elimizden geldiği kadar yardım yapmaya ve hangi alanda sıkıntı varsa o alanda açıkları kapatmaya gayret ediyoruz. Mesela geçen sene Belediyede bir sel felaketi olmuştu. Oradaki sel felaketine Türkiye Diyanet Vakfı, Kızılay, AFAD ve TİKA olarak hep beraber oradaki insanların ihtiyaçlarını karşılamak için gerekli malzemeleri almış ve oraya ulaştırmış, yardımcı olmuştuk. Bundan sonra da inşallah Türkiye Diyanet Vakfı olarak ve diğer kurumlarımız olarak Somali kardeşlerimizin yanında olmaya devam edeceğiz, çalışmaya devam ediyoruz. Biz buradayız, sahadayız, birebir insanlarla görüşüyoruz, ihtiyaçlarını görüyoruz, öğreniyoruz ve onu anında kapatmaya çalışıyoruz. Ben söz verdiğiniz için çok teşekkür ediyorum. Sizlere de kolaylıklar diliyorum. Çok sağ olun.
I will try to summarize what Mr. Oz said. In the beginning, Mr. Oz thanked the global Somali diaspora for giving him this opportunity. Mr. Oz said that the DIANET Foundation has been active and working in Somalia since 2011. He said that the DIANET Foundation works in different areas, including humanitarian aid and education. He said that in the education sector, they run schools both in Somaliland and Somalia. They provide scholarships to the Somali students who want to study in Turkey. And in the humanitarian and social issues, they said that they respond emergencies such as droughts and floodings in Somalia. They said that they they opened or they dug wells, deep wells in different regions in Somalia. He said that so far they have reached or they have opened deep wells in 8 regions in Somalia, and they are now continuing to open 2 new wells in 2 new regions in Somalia. They said that these wells they are intended for long-term to provide water for the people, communities, and also their animals and their agricultural activities. He said that recently they have opened 2 big deep wells in Sol region in Somalia with almost 100,000 people beneficiaries. He said that these activities of the Janet Foundation will reduce the impact of the drought in Somalia. And he said that they also provide food aid to the needy people, especially during the month of Ramadan. And he said that recently they distributed food aid in 2 regions in Somalia, in Gedo region and in Bakol region in the southwest region of Somalia, since these 2 cities or regions were facing severe drought and shortage of food and water. He said that we are here to provide necessary humanitarian aid and response emergencies and help the Somali people. And he said that we are here on the ground. We are seeing firsthand the impact of the drought and the flooding and the crisis. And he said that they were meeting the affected people in person, and getting first-hand information and responding accordingly, and they will continue to do so. Thank you. Now,
thank you very much, Yasin, for such a summarizing. We are actually proud of our Turkish, diaspora who are also back to the country to contribute the rebuilding of the country, and today actually we're benefiting that such a interpretation session. Is other colleague from Turkish Commission, is he there?
Yes, he's here, and I'm now giving the floor to him.
Herkese merhabalar. Türk Kızılayı yaklaşık 10 yıldır burada insani yardım faaliyetlerini birçok çeşitli alanda sürdürüyor. Bu faaliyetlerin içerisinde kentsel dönüşüm faaliyetleri, insani yardım faaliyetleri ve buna benzer birçok faaliyetler vardı. Şu an günümüzde ise kıtlıkla ilgili olarak birçok gıda yardım projemiz var. En büyük projelerimiz Ramazan ve Kurban projeleri. Bununla birlikte Somali'nin bazı bölgelerinde sürpriz projeleri gerçekleştirdik ve gerçekleşmeye devam edeceğiz. Bununla birlikte COVID kapsamında yaptığımız birçok çalışma var. Öncelikli olarak birçok toplu insanın bir arada bulunduğu hastaneler gibi yerlerde bilgilendirme çalışmaları gerçekleştirdik. Herkese maske dağıtmaya çalıştık. Maske kullanımının önemini anlatmaya çalıştık. Hijyen kitleri dağıttık. Ateş ölçerler dağıttık. Solunum cihazları getirdik ve hastanede solunum cihazları teslimatları gerçekleştirdik. Birçok çeşitli ilaçlar getirdik ve hastanelere dağıtımı gerçekleştirdik. Şu an Kadın cezaevinde bulunan bir meslek edindirme kursumuz var. Bu kursumuzda da şu an mask üretimi sağlıyoruz ve ihtiyaç sahiplerine mask üretimi dağıtıyoruz. COVID kapsamında bunları gerçekleştirdik ve devam edeceğiz bunları gerçekleştirmeye. Sahada çalışan biri olarak çok alanda eksiklerini görüyoruz, ihtiyaç sahiplerinin ve bu alanda eksikliğini gidermeye çalışıyoruz. Bununla ilgili de sadece Türk Kızılayı değil, Diyanet Vakfı değil, Türkiye'den birçok kurum ve kuruluş var, organizasyon var. Bu konuda da elçiliğimizin bünyesinde toplanıyoruz ve bizi gerçekten çok destekliyorlar. Onlara çok teşekkür ediyorum buradan. Kuraklıkla ilgili olarak önümüzdeki günlerde tekrar gıda projelerimiz devam edecek. Kurbanla birlikte devam edecek. Kurbandan sonra devam edecek ve bir su projelerimiz olacak tekrar. Zaman ayırdığınız için ve bizi dinlediğiniz için ben teşekkür ediyorum. Çok sağ olun.
Mr. Orhan explained the activity of some of the activities of the Turkish Red Crescent in Somalia in terms of the COVID-19 response and in terms of humanitarian aid. He said that the Turkish Red Crescent office in Somalia in Somalia, you know, they provide humanitarian aid to the people who are in need in Somalia. These activities, humanitarian activities, include distributing food to the affected people, and also in order to get a durable solution, they dig wells in the affected regions and areas, and also during the COVID-19, they made contributions in order to prevent COVID-19. You know, these activities include awareness to the people, especially to give the people all the necessary information about COVID-19, all the necessary awareness, including to wear a mask and the importance of wearing masks, and to the importance of the hygiene and washing hands, and also they distributed masks and test kits and also ventilators to some of the health centers or hospitals in Somalia. They have also they're also supporting a project for the women prisoners in the central prison in Somalia, in Mogadishu, where women prisoners produce masks. They're also supporting, these kind of projects, and they will continue to do so. And he said that they are in coordination with other Turkish organizations such as TIKA, Diyanet, and other NGOs, other Turkish NGOs working in Somalia. And lastly, he thanked the Global Somali Diaspora for organizing such an event and giving him the opportunity to explain what they're doing in Somalia. Thank you.
Thank you very much, Yasin, again for summarizing us the speech of Orhan Koçu from Turkish Red Crescent. Thank you very much, August Yilmaz and Orhan Koçu from Turkish Red Crescent and Diyanet organization. We are very grateful to hear about your contribution towards humanitarian aid to Somalia, especially COVID-19 and the drought impact as two subjects of the online summit today. so the providing the vital resources, including the PPE, and supporting especially prisoners with PPE equipment, and raising awareness about the COVID and impact and prevention and approach. So thank you so much for that input. Again, thank you very much, Yassine, and I would like to also thank the Turkish embassy, who actually facilitated this contribution today. Thank you so much for that. So now we had a lot of international communities-led responses, towards the COVID-19, as well as the drought's impact. We want to look in terms of Somali-led responses, and I would like to invite Abdullahi Osman, who is CEO of Hormuz Foundation. We know that Hormuz is actually a very pioneering kind of an organization who actually supports the Somali humanitarian in Somalia. And the branch of Hormuz Foundation runs a lot of different humanitarian input, including the health and schooling, the drought response, emergency responses. And so Hormuz is one of the Somali, obviously, private sectors who actually take very seriously its social corporate responsibilities. And we're pleased that we have Abdullahi today, who will be giving us an kind of insight, the Somali-led response to the current situation crisis. Welcome, Abdullahi. Thank you for joining us today.
Thank you, Jawaahir, and all participants of this conference. It's a great moment and great opportunity. As you said, my name is Abdullahi Osman. I'm the head of Hormuz Salam Foundation. The name has changed from Hormuz Foundation to Hormuz Salam Foundation, which is the corporate social responsibility wing of Hormuz Telecom and Salam Somali Bank. Over the last 9 years, as CEO of Hormuz Salam Foundation, I have seen tremendous growth in Somalia. I have had the privilege of working with the Somalia expanding private sector to bring life-changing assistances to our local communities. This year, we have faced challenges on all fronts, but I have never been prouder and more steadfast in my belief in the resourcefulness of the Somali people. I am really saddened that Somalia is facing a difficult second wave. So I firmly believe that if we rise to it together as a united Somalia, we can support our people and business through this critical time. When the pandemic first hit in Somalia, early in 2020, Hormuz Salam Foundation, we have shifted our resources to supporting the needs of the population living through global pandemic. We were well positioned to meet this challenge as we already work in medical, educational, job creation, microfinances, and other programs aiming to support those who less fortunate. In early 2020, Hormuz Salam Foundation and its partners, we actually set aside $5 million toward our country's coronavirus healthcare and pandemic relief efforts. Also, we have created a free toll number, short code 449, for as a relief a helpline. We also bladed our ringtones in public health awareness about the coronavirus. Also, we assisted the Somali government and especially the Minister of Health, the creation of the national call center, where the patients or those who are actually having the coronavirus issues can reach out to the doctors, and those who are really will be direct to them. Actually, for the past few years, we have been working here in Somalia. In Somalia, we actually contributed the rebuilding the Somali health infrastructure, and we worked with most of the public hospitals throughout the area we operate in South Central Somalia, providing medical equipment, assisting them rebuilding some of the hospital departments, and also providing urgent needs healthy requirements. When the pandemic hit, I put the weight of the foundation behind the rapid renovation of 4 departments at Banat Hospital in Mogadishu. We installed special COVID-19 facilities in short time, in 2 months. The renovationists created extra capacity of 200 beds, making it easier for the region's healthcare professionals to treat COVID-19 patients. Our most recent donation is in the second wave in 2020. Actually others I mentioned it. The real challenge was accessing to oxygen in public hospitals in Mogadishu, especially in the Martin Hospital, and we supplied.
I went out in. There's no picture anymore.
There's no picture?
No.
You came back and there's a picture.
Yours is there?
No, it's came back.
Can you zoom yourself, please? Can you zoom, mute, please? Mute yourself on speaking. Only the speaker, please. Thank you.
Yes, actually, yes. In February 2021, when the second wave actually started here in Somalia, which was very bad compared to the first wave, we supplied oxygen cylinders to Martin Hospital, and we were supplying the oxygen from end of February throughout in March in 2021. Also, we purchased 400 cylinder oxygen from United Arab Emirates, and we delivered in Somalia just 2 weeks ago, and it was delivered to now in Galmudug regions. Also, we have purchased first ever oxygen plant for public use from Turkey, and we are hoping that it will reach in Somalia within the next 2 weeks. Actually, our efforts actually was really and hugely appreciated by the Somalis and Somalis working in Somalia. Also, we facilitated a number of services which is very important for the life saving in Somalia, such as the cash transfers or the cash aid delivered by the international humanitarian agencies, which really helped a lot of those who are really in need in Somalia, especially in different areas. Also, we were working very hard for the last few weeks to assist those who are affected by the drought in Gado region, especially to get access to clean water. As we operate in South Central Somalia, which are the most volatile parts in Somalia, we were those who fairly active whenever problem or challenges arises, because we are a party of the local communities. Also, we have a infrastructure throughout those regions. So, and then our assistance or our move become the most effective and the most efficient as we use our own resources, whether a technical or a financial or human resources. Actually, at the moment, as we are experiencing the second wave, the first vaccine delivered by the WHO program given us a hope, but there's so much more to do. So far, the vaccine is allocated to Somalia fall way short for inoculation targets, and I urge the international community to play their part by supplying sufficient vaccines for the Somali population. Somalia are resilient, and Hormuz Telecom and Hormuz Salam Foundation, we will continue to support the Somali people throughout this global pandemic and into the Bosi pandemic. The situation in Somalia at the moment has been set. The challenge is getting actually bigger because of the currently political climate in Somalia, and also the drought and the COVID-19. When you compare the second wave in Somalia was more deadly compared to the first wave, because the first wave, the Somali government, they really, the government worked really very hard, especially the previous government. The former Prime Minister Hassan Khairi, he put all his efforts to deploy all the resources, whether in Somalia or from the international donors, to assist those who are really in need. But when the second wave, for example, a rise in Somalia, and the situation was really very critical, and one of the biggest challenges is the weakness or the absence of the viable and working public institutions, or especially in the Somali public health sector. And I believe that what it's really Somalia is needed is to rebuild the Somali health infrastructure. The Somali public, whether they are inside or outside Somalia, they are working very hard to assist our people. Now the second wave is actually, for example, is slowly came down in Mogadishu, but it is spreading over the other regions, especially in Puntland and in Somaliland. What I know is that the business community in Puntland, now they were organizing themselves, trying to find out a solution. The lack of oxygen there in Somalia. So it was really very painful that when a year ago the first wave has started, and then the second wave started, and the second wave came a year later, where we were in the same situation. I mean, the lack of oxygen plants. So what I would like to suggest is that the Somali global diaspora and the Somalis, whether they are inside or outside Somalia, to stood up together and to work on how we could rebuild the Somali health infrastructure together. Thank you.
Thank you so much, Abdullahi, for that insightful information. It is really encouraging to hear how not only Hormuz Salam Foundation is responding to the crisis, but also how other Somali private sector business people are actually organizing themselves to respond to this, COVID pandemic. It is really a great example in terms of how Hormuz Salama Foundation contributing to the public health awareness. The renovation of Banadr Hospital has been greatly utilized. The Martini Hospital as well, providing the oxygen supplies, as well as organizing now the implants to enable other regions to have implants, oxygen. I know a lot of effort is happening at the moment, led by as well Somali private sector and civil societies. I know that second wave actually has been deteriorating on the ground, but it's encouraging to see how Somali led effort is actually, it is also working on the ground. Thank you so much, Abdullahi, for that input again. I would like to welcome now our next speaker, which is Dr. Deqo Waqaf. Dr. Deqa, she is somebody who is very, very visible and active in terms of the Somali diaspora efforts to contribute to the health and well-being of Somalis. But also she is the daughter of a very well-known, mother and Somali public figure, Dr. Hawa, who has been the backbone of our community actually during the civil war and beyond, and providing health provisions the most difficult time in Somalia, and we really miss her, and Allah, grant her in Jannah. We're honored really to have Dr. Deqa with us today. She's going to be talking about in terms of how we can increase our efforts to double up, and also Abdullahi Hassan, and who will be also talking after Dr. Deqa. They're both, part of what we call But Bad Enough, which is actually Save a Life. That effort actually is a Somali-led effort, which is actually looking how we can increase the oxygen implants, not only in Banadr region, but across the Somali regions, as the capacity is very low and is stretched in terms of providing the vital health treatment to those who have been impacted by COVID. So without further ado, Dr. Deqa, welcome. The floor is yours.
Thank you so much, Jawaahir, and everyone in this group. I was enjoying for the last 3 hours, just learning more and getting inspired. All of us thinking how we can improve the being in Somalia for the last 14 years as a doctor, being on the ground, working beside my mother and seeing my community. My role in Somalia mainly is a humanitarian health. That's my main focus, making sure IDPs and people who really forefront need help get the service they need, especially mothers and children. So seeing all that, and one of my drive joining in this group and many other efforts in COVID-19 was worried about IDPs, people who cannot afford to buy one oxygen cylinder when effort of second wave came, COVID-19, and the hospitals was lacking oxygen, and you need to buy $500 one cylinder oxygen that might have, less than 5 hours for the continuation of oxygen to that patient. So really what we want to bring in Somalia, and all my life, what I have seen is handouts, one effort to another. If you look, the budgets was presenting different NGOs before me, billions of dollars spent in Somalia, humanitarian aid or any support. If I take another point of example, distributing water in water tanks, how many years we doing that and how many billions we spend on that, millions of dollars, where we could build effective wells and to have effective water running into those communities instead of keep fundraising and spending same money and again and again and again. So in our group at Bad Enough Save a Life, what we put together as a comprehensive need of oxygen plants, and we set up a very clear goals. We just want to bring 10 oxygen plants in main hospitals, 4 in Mogadishu, where there's a higher population, over 3 million, and the rest in the six hospitals in 6 regions of throughout Somalia, including self-declared state of Somaliland. So those are what we want to bring in, sustainable effort that if we leave, COVID-19 goes away, maybe 3 years or 5 years, but still the community and hospitals have oxygen plants in place, and every patient we're bringing into that hospital or any patient I refer will receive oxygen when at his bedside. And what we did is we collectively, we collect effort in national businessmen and local NGOs and doctors and hospitals and everyone who could take part. Young volunteers are going step by step in the doors, and my colleague Abdullah will explain you how we set up that community organizing system to fundraise, especially this month of Ramadan. And Hormud, we are our biggest supporters and a member of our group. Also, Abdullah is our chair, one of the deputy of chair, contributing the biggest contribution to oxygen plants. They already ordered oxygen plants are coming into several major hospitals, are receiving next 3-4 months. So I will welcome my colleague. I can talk a lot. I'm very passionate about Somalian issues, but I want to share with my colleague, and the time is too limited for all of us. But I want to, I hope Chris is still around. If it's not, you can pass this message. Chris was talking about the philanthropy and how money is available. And we want to GSD to help us to set a system in a place so we can receive that funding to effectively equip our hospitals. Pandemics might come again. A crisis is everywhere in Somalia. And we make sure our hospitals are equipped well and make sure they have the skills, the people have the skills and management tools in place to help those and to support also the Minister of Health. It's our leader, and Obaha was presented well in issues on the ground. If our Minister of Health has no funding or capacity to do their work, we as a civil society, what we can do is very limited. So we have to do this as a collective, sustainable goal to improve the Somali system and the healthcare situation. Thank you, Abdullah. You're welcome.
Thank you very much, Dr. Deqa, for such insightful information in terms of this new initiative, which is quite very useful. And I welcome Abdullahi. Abdullahi Mus Hassan is also my ex-colleague, is also from my city, Leicester. I proudly, like to present to him that Leicester is part of contributing to the rebuilding of our country, homeland. Abdullahi is a businessman, but also somebody who is very passionate about addressing humanitarian issues, and he went back years back to the country and as a businessman, but also participating in the humanitarian aspects of the country. And welcome, Abdullah.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Thank you very much, sister, and everyone else. Jawaahir, many thanks. And Dr. Deqa, I welcome you all. Thank you, and Ramadan Kareem. The topic of today was really important, and I'm very happy to take part of this. Dr. Deqa almost touched the points, and I will not add a lot to what she said. Now, the situation in Somalia, especially during this COVID pandemic, is really serious. And what we have noticed is that the Somali people, and led by the members of the Somali diaspora, across the country, from within the mainland Somalia, as well as the Somali regions in Ethiopia and in Kenya, are working together collectively, to be honest, and I've been able to visit those places as far as Chikchiga, Hargeisa, as well as even as far as Harar, and in Kenya as well. And what we have noticed is the same pattern, that the people, if they are given the opportunity to support one another, they are very actively giving contributions and supporting one another. This initiative of Bad Enough was started last year in response to the COVID-19. What we realized was that we needed to do sustainable contribution rather than emergency relief. We noticed that a lot of agencies are busy and working along the lines of emergency support. So therefore, we focused on sustainable initiatives. And the first thing that came out was that the country had only one oxygen plant in one hospital. That was the Recep Erdogan Hospital, the ex-Dikfir, rebuilt by the Turkish Minister of Health. That was the only hospital that was equipped with oxygen plant. All other hospitals, private, public, there was zero. And that posed a big challenge. And the oxygen production at the market was also limited. In Mogadishu, there was only 2 factories that were providing oxygen to the private sector. And in fact, since there is no industries that require oxygen, the need or the demand for people to provide this was limited. Therefore, there were only 2 companies that were providing, and as a result, their production was not enough to treat patients that needed 24/7 oxygen supply at Martina Hospital and other hospitals. So we started initiatives where we said, okay, let's raise around $3 million and bring 10 oxygen plants. The initiative was supported and welcomed by all members of the Somalis. In fact, everyone we talked to was really eagerly happy to support. And the first wave stopped, thanks God, with less impact compared to the rest of the world. And we continue to engage the private sector in order, and the public, in order to secure those 10 machines. Now we can say we have almost about 5 machines in the pipeline. Thanks Hormut, they have equipped it and renovated and made the biggest hospital ready with 200 beds. They are already supplying the first machine coming soon, and we've got Dahabshil also bringing another machine. We've got another private sectors. Members of the private sector bringing some more machines, and so the initiative was welcomed by all those private and individual members of the society. And not only now is it that the machines that we have pledged are coming, but also the private sector hospitals are bringing their own machines. So that has created a kind of awakening sort of call, where all those private hospitals were not aware of the fact that they needed, or if they were aware, they were not able to take that final decision and to source the machines they were required. So now in Mogadishu alone, there are about 10 hospitals that have ordered their own machines. And beyond Mogadishu, we have seen communities organizing themselves in Puntland, in Somaliland, in Galmudug, in smaller regions like Las Ano. The local communities have already made arrangements. We know there's a city near between Hargeisa and Wajal, the city of Amut University. I just cannot pick up the name, but we know they have already purchased their machine. So the communities have organized themselves across the country, and now there's good things taking place. So that is what we wanted to encourage people in order to do sustainable and long-lasting solutions to the problems that recur every year. So at the beginning, people were saying, if you bring those machines or if they come to the country, they will not be working for a long time. But what we have seen is now that they have changed we have managed to change the mindset of the people. And even if the first lot of machines don't work, the concept of opening hospitals without oxygen plant is for good gone, and people are now aware of the fact that they need to bring the solutions for themselves. So that is the kind of public engagement that we want and mobilizations that we wanted to create, where we would like the GSD to take part in engaging the diaspora community, to get back to the country and to bring whatever initiatives that they have, as well as organizing the local of their own area in order to do sustainable projects. Drought can only be sustained through sustainable projects. It cannot be sort of corrected by supplying water when the drought comes around. What is needed is livestock farming businesses, in fact, in the form of businesses where diaspora members of diaspora can come back and invest in the country and in livestock, and show people how to make business out of these opportunities, and people will respond and react accordingly. Therefore, we will like to encourage people to take positive steps in terms in towards sustainable efforts. We like to thank again organizations and businesses that have taken part of this but bad enough process, where we have organized young people, local media, radios and TVs, and almost everybody has given whatever they can in their own capacity. So I think that is needed to be duplicated across the country, and all members of the diaspora community are in fact encouraged to do the same. And thanks again for those who contributed, and thanks for the GSD for organizing this wonderful event, and I'm sure it will continue to support the Somali people. Thank you.
Thank you very much, Abdullahi, again, for elaborating in terms of the initiative of But Bad Enough, Save Life, and the effort is led by Somali community, how you are trying actually to gain resources to equip the hospitals with implants, oxygen, and spread this through different regions in the hospitals. And I think that is absolutely a noble initiative. And GSD actually is supporting this initiative, and we're doing awareness raising a series of one, which we have done last week. This is also contributing to that as well, this session today. And also there will be different sessions across the countries. So next week we will have Australia. After that we will have UK, and we will be having also across the globe sessions supporting this initiative, Save Life. I know I really want to apologize in terms of running late out of the time, 17 minutes now. We should be finishing at 1 o'clock, but because of the delays and some of the technical difficulties, as well as that we had extensive presentations for our guest speakers. So I apologize for that. Hopefully we will be concluding soon. I would like to give the next speaker, which is my co-host, actually, Raphael Caponey, to talk about increasing efficiency and collaborative approach. We were talking all, the session, and there are different responses, different organizations led by different international communities, as well as Somali efforts. So it is time now to look in terms of how can we increase efficiency, how can we increase collaborative approach, how can all these people work together to avoid duplication, and also increase, the efficiency of responding to different areas that has been hit by the COVID and the drought. And so I welcome Raphael to give us a summary of that. Thank you very much. Thank you. Welcome, Raphael.
Thank you very much, Jawaahir, for this introduction. And in the interest of time, I'll try to be as brief as possible and as straight to the point as possible. So yes, I think this is a very important point to look at efficiency and to look at coordination in the humanitarian response when we want to address critical need like we see currently in Somalia. So at the moment, there is an ongoing coordination in Somalia organized by the international actors, which is called the cluster system. So there is for every sectors, there is what is called a cluster with an UN agency leading and co-hosted by an NGO. And this is how NGOs, national NGO, international NGO, and UN agency ensure that they don't duplicate and that they share a common view on the needs on the ground, and that they are responding adequately to these needs, like by splitting by geographical location or splitting by different sectors and so on. And then what we maybe is a little bit new to the humanitarian response is that we see that increasingly diaspora and diaspora organizations have a really large impact in humanitarian response. And Somalia is a very strong example of that, when we see that the diaspora community is able to mobilize, is able to support support the population in Somalia directly or through NGOs that have been created abroad or association or groups and so on. So DEMAC, in the initiative I work for, is trying to strengthen coordination and look into synergies for a better collaboration and coordination between diaspora organizations, and then with a better link with the institutional humanitarian system, so UN agencies, international NGOs, and so on. So I'll very quickly share my screen to present just a few points on that, and also talk specifically about Somalia. Sorry, I haven't shared the right. And talk specifically about Somalia because we have conducted a case study on Somalia, and we can see that there's a lot of diaspora organization providing a lot of very strong assistance there. So very, very quickly, DEMAC, we're looking at enabling inclusive coordination and collaboration between diaspora organization and humanitarian institution. And we are looking at facilitate higher level of engagement and visibility for diaspora organization. How do we do that? We look at increasing knowledge on the impact of diaspora organization, and also for diaspora organization to be aware about the institutional humanitarian system, the cluster, how it works, and so on. We are also raising awareness about the role of diasporas, remittances, and diaspora organization providing humanitarian assistance. And we are looking at improving coordination, as I was saying. So this is a little bit of an extract of what I was saying. The case studies that we have been recently conducting and show that there is a lot of diaspora organization. So often they are NGOs that have their headquarters in Europe, where the diaspora is, or in the US, where the diaspora is based. And these diaspora organizations are able to provide humanitarian assistance on the ground. So we see, for example, Somali Faces is a famous diaspora organization. And recently, last month, they were providing water to over 400 families in the Ghetto region, and they are based in the UK, but they actually have an office in Somalia and responding to the needs. There's also IRDA, it's another diaspora organization based in the Netherlands, but also able to provide a lot of assistance. They also have their own offices and staff on the ground. They also work with the United Nations and so on. And then there is Ganane organization who's based in Finland and also providing water and other providing humanitarian supports in various parts of Somalia. So these are just 3 examples, but we see that there is a lot of DOs, and I think this is something the diaspora community at large can also support. When they support this diaspora organization, they are contributing directly to humanitarian response in Somalia. So that was really that's a small highlight of the case studies. We can share more about this. I will have the full case study shared next month, so we can also share that broadly if you're interested to read more about the impact of DOs in Somalia. And then finally, we are also looking at strengthening the coordination and looking at better efficiency between diaspora organization and the institutional humanitarian actors. And we have actually a specific workshop on this next month on Saturday, May 29, for diaspora organizations. So if you are a diaspora organization and you're willing to discuss the efficiency and response and collaboration, you're welcome to join. We'll have an open call for application on Facebook and Twitter. But as we see, diaspora organizations are playing a key role. We saw it during this presentation. They are linking with the diaspora community abroad. They have a link with Somalis in Somalia. They're also linking with NGOs. So they are really increasingly a key actors in the response and in supporting Somalia. So this was my main points on the topic, and I think, if I'm not mistaken, I'm the last speaker for today. So
yes, you are. Yes, you are, Raphael. So I think people will be relieved. We bombarded them with speakers. But they have been brilliant, absolutely vital information and good practice has been shared. If we have, I think we don't have much time, but if we have any, maybe 1 or 2 questions that has not been answered, because I think, some of the questions I have seen, it has been already covered in the presentation. And there are some questions that the speakers are not with us anymore, who was able to actually respond to these questions. the technical team, is there any questions that you think, the current speakers able to respond? One or two? I'm happy to take that. Suad and Bazi, any?
And no questions I can see at all.
Okay.
The all questions there is already answered. There's no other questions.
Yes. Thanks, Suad and Bazi. I've seen that some of the questions has been already covered through the already presentation that has been said. So in that case, we're gonna actually conclude our summit, online summit today. I would like to give Raphael first to have conclusion marks on our international communities, and then I will have the rest of the conclusion remark. If you don't mind, Raphael.
Yes, absolutely. Thank you, Jawaahir. No, I think it was an extremely interesting summit, and it was so interesting to see also the broad perspective from international community, UN agencies, INGOs, but also medical experts, doctors, local organization, the private sector. So we really had a very, very broad overview, and that's really, really interesting. So for the conclusion, I'm going to start a little bit from the perspective of, from the international community, because they have a bit of an overview of the needs and the crisis and the funding situation. So we did have this confirmation from OCHA and WHO, the World Health Organization, that there is increasing need in Somalia due to a combined crisis of the droughts, COVID-19, locust infestation, and that the needs of the Somalis and their situation is deteriorating. And also what is quite alarming is that in the same time, we see that the funding for humanitarian response is decreasing significantly. And one of the key actors in the humanitarian response is WFP, the World Food Programs, which is providing food assistance to the population, and their budget has been cut in two compared to last year. So this is really showing that Somalis in Somalia are currently facing more and more needs and a very difficult situation, and the help that is provided to them is going down. So it's really a double difficulty, I think, for Somalis, and that we really need to be aware of. And I think this summit was really came out of it, and even OCHA presentation highlighted what they call the IPC level, which is basically the level of food insecurity in the country. And we see that so many regions are on IPC level 3 and 4, which is very high. It's a scale out of 5, and 5 is famine. And famine is extreme food insecurity, and we are very close to this level. So I think that's quite worrisome. That's quite alarming, and it really highlights how difficult the situation is for Somalis today in Somalia. And there were a few points also highlighted by OCHA, highlighting that the diaspora community abroad can also advocate to the international governments to continue to support Somalia, because they see that the needs are increasing. But they can also contribute by supporting with remittances. It was highlighted by international NGOs that by Jim from DRC that the remittances have decreased by 40%. Which is huge. It means that more than a third of Somalis are receiving no money or much less funding, and obviously this is critical for the day-to-day life, for being able to buy their just basic needs, and that's why we see that a lot of people are having to sell livestock. They cannot even afford a full meal for the day. They have to cut the ration for the family, and that's really critical. But I think we also and we also saw that the NGOs were also saying that they are trying to help, and they are doing their best, but they feel that it's a little bit of a drop in the ocean what they are doing compared to what the needs are. Again, because the funding is going down, and in the same time the need of the population is increasing. And so I think that's really what were the main thing that came out from the international community is we are facing a difficult, very difficult situation, and we are not able to respond to it completely. We are doing our best, but we are not there yet, and we need awareness, we need mobilization. We need international donors to mobilize themselves, and we need the diaspora community to also support us. So I think this is really what came out of this summit, especially from the international community perspective.
Thank you very much, Raphael, for summarizing and so eloquently the input of today's summit from international perspective. And I would like to echo in terms of Raphael, in terms of the diversity and perspectives we had during the summit from a range of different organizations and also civil societies, private sector, and Somali-led efforts, as well as international communities. It was very clear from Director General of Humanitarian Affairs and Disaster Management and the challenges the Somali federal government is facing in relation to respond to this crisis. And we have seen the presentation is from Dr. Ubah from Minister of Health perspective, the second wave and how his situation is deteriorating, the lack of capacity, and especially as has been also mentioned by the Safe Life Initiative, the lack of oxygen implants at the hospitals, across the country. It has been also mentioned by Mohammed Abdul Khair from IOM, the impact of climate change, especially on rural areas in the East Africa regions, especially in Somalia. The transnational movement immigration is IDPS, and the COVID-19 impact, especially for those most actually vulnerable, including the IDPS, and that's international internal displaced people. We have seen the efforts of international communities, whether it is, the UN from IOM to Turkish, organizations, the responses, led by Danish Refugee Council, but also, as Raphael mentioned, it's a drop in the ocean. Sometimes when you hear all these support that is going on in the country, you're thinking like, oh, then what is the problem? People are responding to the crisis, and there's a lot of support going on the ground. But as Raphael said, that the demand exceeds, what organizations are able actually to provide, and hence it's kind of a drop in the ocean. The Hormuz Salam Foundation efforts has been tremendously useful, equipping and also supporting hospitals and improvement, renovations, providing supplies vital to respond to the COVID, especially the call center. I think that has been very, very, very helpful nationally, and we heard from the initiative of Safe Life, but bad enough from Dr. Deqa and Abdullahi, in terms of the efforts of Somalis who are actually trying to be more sustainable, basically, and equip and strengthen hospitals with oxygen implants. And that effort is going on, and there's a lot of fundraising going on at the moment, as I said before, and GSD is part of that. And Raphael also discussed about the importance of and collaboration, and I think the case studies of diaspora has been and very insightful in terms of how people can actually, if they work together with a minimum resources, they can achieve actually more higher positive outcomes. So strengthening our collaboration is quite very, very important. I would like to conclude that first of all, to thank everyone who, attended and contributed in very short notice, because we are actually facing an kind of emergency crisis situation in Somalia, especially the drought and the COVID. I think the drought actually, the information we have received today shed light is actually more serious than we thought, basically, and it's quite actually urgent a need to support people before we reach, as Raphael said, famine situation. So the diaspora, actually, I would say that we need to get our act together. We need to mobilize more and re-energize ourselves to support the country. And I will say to donors that it's not time to reduce the funding. And I think, most of the time now, donors and also international communities, many of them, those who are not involved in humanitarian, it's actually they're more focused on political crisis, which is happening at the moment, which is actually fair and perspective. However, part of this, an online summit aim was actually to shift that to humanitarian crisis, because we need at the moment, we don't want to see Somalia a catastrophic and crisis. We need to prevent it to reach a famine or health pandemic across the country. And therefore, we are appealing to donors not to reduce it, but increase actually their donations to support, but also Somali Diaspora as well. We need really to mobilize and increase our efforts to support the country. With that, I would like to conclude our summit. I would like to thank DEMAC, who was the co-host of the summit, and also IOM, the efforts to support the summit, to actually contribute in terms of getting our key speakers in very short notice, as well as supporting the technical aspect. And I would like also to thank our GSD team, and who were working behind the scenes non-stop day and night to enable the summit to be and held, as well as to actually run smoothly. Our technical guru as well, Roshi Singh, thank you very much for being in our background and supporting the summit, as you did the International Somali Conference last year, to ensure that the technical aspect of the summit was going smooth. Thank you very much, everyone. And hopefully the summit has been recorded. It would have a video recording which will be put on GSD YouTube, but we will share with all our speakers and participants. And we will also produce an summary report for the summit, the recommendations as well, so that we can follow up, what in terms of, because this is just the beginning of actually supporting this effort. It's not at the end. And thank you very much, everyone who has contributed. Thank you.